Muy buenos días. ¿Cómo está mi gente? Let me give you a very warm welcome to today, our day 2 of our summit. It is such an honor to have you all joining us today. My name is Cecia Aquino. I have the pleasure of serving as Deputy Director at the Latino Coalition for a Healthy California. Our theme this year is Fortaleza en Comunidad, 30 years of advancing Latinx health equity through community solutions. At LCHC, we pride ourselves in translating community solutions into equitable policy and lasting change. We center community in everything we do. And we do this work in collaboration with you all, our partners and community. So it means the world to have you here with us. We want today to be an engaging day, just like yesterday, having those back and forth conversations, the very rich panel conversations to discuss the many issues that our community is facing and that we get to have a say in creating the Latinx Health Equity Agenda for next year. Today, you will hear from wonderful speakers. We will have many engaging panels. We will also have a walkthrough of our community data, which we've actually worked really hard on this year to work with community and really hear from them. What is going on in their communities? What do they need? And how can we help and support? So we will be having a full set engaging you today. In addition, we have some very fun guests. We have the Chulita Vinyl Club joining us for a wonderful set during our Tiempo de Poder. And we also have spoken word by Cielos' Luis, who will be joining us and sharing some powerful poetry with us. With that, let me give you a warm welcome. And to get us started, I'd actually like to begin by introducing one of the esteemed members of our board, Isabel Becerra. Isabel is the CEO of the Coalition of Orange County Community Health Centers and has more than 30 years of experience working in public health. We are so lucky to have you on the board, Isabel, and so lucky to have you here. Welcome.
Thank you, Cecia, and good morning, everyone. Welcome again. My name is Isabel Becerra. I am it's my pleasure to serve on the board of directors with the Latino Coalition for a Healthy California. And as Cecia mentioned, with my day job as president and CEO for the Coalition of Orange County Community Health Centers, I strive each and every day to ensure access to quality, culturally and linguistically competent healthcare for all. It's been my passion and mission ever since I entered my career in healthcare. As LCHC enters its 30th year, it becomes important for us to sit and reflect, not on how far we've come, but on how far we've yet to go as a community and as a state. As you all know, unfortunately, the pandemic highlighted the inequities in access to care amongst our most vulnerable communities of color, but we're here to prove that our resiliency is stronger and we will persevere. The theme for this year's summit is Fortaleza en Comunidad, 30 years of advancing Latinx health equity through community solutions. I'd venture to say that the most important aspect of this theme is at the very end, which is equity through community solutions. We also learned through the pandemic that none of us can do the work that we do on our own. We need our partners, we need our friends, we need everyone who shares and is aligned with the mission of increasing access to health and addressing equity issues amongst our community. Comunidad is why we're gathered here together today virtually. Comunidad is who we serve and the why we serve and why we care so much about public health and the salud de nuestra gente. We are a community of community health workers, policy advocates, students, sons, daughters, siblings, mothers and fathers, nietos y nietas, all striving to make healthier California. Today, we'll be hearing from some amazing speakers, beginning with Congressman Raul Ruiz of California's 36th District. And before we get to him, I'd like to take a moment to introduce Dr. Jeffrey Reynoso, who will lead us in introducing our next speaker. Dr. Reynoso, take it away.
Thank you so much. Gracias, Isabel, for that introduction. And thank you so much for serving on our board and being such a incredible partner in this work. I also want to give a huge thank you to Telemundo 52. We're so grateful for your partnership in the summit and getting the word out. And thank you all out there who are joining us here in the Zoom room, but also on Facebook Live and YouTube. We have folks joining us from all over California, made up of promotoras, clinic staff, statewide policy advocates in Sacramento, community leaders from all regions of the state, state elected officials and their staff. And we've even seen a couple of physicians and frontline staff who joined us throughout the conversation yesterday and here today. It is now my pleasure and privilege to introduce our keynote speaker for this morning. Congressman and Dr. Raul Ruiz represents the Coachella Valley and most of Riverside County. As a son of farm workers and a farm worker himself as a young person, Dr. Ruiz was a trailblazer for the communities of the Eastern Coachella Valley. As a young child, he went business to business, asking for community support to send him back to college with a promise, a literal contract he made to return back, give back, and serve his community. Well, he not only came back to the Coachella Valley with a bachelor's degree from UCLA, go Bruins, but he also came back to the Coachella Valley as a medical doctor with a master's of public health and a master's of public policy, all from Harvard University. Que orgullo. He now serves in Congress and is the chair of the Congressional Hispanic Caucus, where he's been an advocate for our Communidad and a national leader, especially during this time of the COVID-19 pandemic. As a physician and medical doctor who's worked in rural communities providing care to the most marginalized, and as a Latino, we cannot have a greater ally. On a personal note, I am proud to call Dr. Ruiz my friend and my mentor. Let us welcome el congresista, el doctor, champion, advocate, luchador, fierce defender of our communities, Dr. Ruiz.
That was a good one. That was a good one, Jeffrey. That was wonderful. Thank you so much. Good morning, everybody. My name is Congressman Dr. Raul Ruiz. I'm an emergency medicine physician, public health expert, and I represent California's 36th congressional district in the United States House of Representatives. I'm also the chair of the Congressional Hispanic Caucus, a 36-member strong group of representatives with 4 senators who advocate day in and day out for Hispanics throughout our nation. It's an honor to be a part of this year's Health Policy Summit. Thank you to my friend, Executive Director of Latino Coalition for Healthy California, Dr. Jeffrey Reynoso. He continues to amaze me in the quality of work that he does ever since he was a fellow in my office many years ago. Thank you for inviting me to participate in today's discussion, as well as for your incredible leadership at the helm of LCHC. I'd also like to recognize everyone participating and everyone involved with LCHC for your work to protect our most vulnerable communities, especially in the last 2 years. Throughout the pandemic, you all have stood on the front lines of this public health crisis, never giving up or giving in to the challenges that we faced. And I'm so grateful for your leadership and your incredible work to address the social determinants of health, increase vaccines access to underserved communities, and engage our state's youth with health education. For 30 years, LCHC has stood tall as the only Hispanic-led statewide policy and advocacy organization devoted to health equity. And you all know as well as I do that the fight for equity cannot be won without civic engagement or without advocates such as yourselves leading the charge. So achieving health and social justice truly begins at the community level. And it starts with each of you who understands our communities, the injustices that we face, and the solutions that we need.
Because she said our oven isn't working right now.
Somehow they make the bagel.
I think there's somebody with
I really don't know. I don't know. Yeah.
So if everybody can mute, I think that'll be helpful. So I know firsthand how important it is that we as healthcare providers use our voices, experiences, and expertise to advocate for change. You see, I grew up in the barrios of Coachella in a farm worker trailer park. And in my earliest years, I remember seeing good, humble people who loved God, worked hard, and struggled to make a better life for themselves and their children. I also saw their needless pain and suffering due to their poverty and lack of access to healthcare resources. And I remember at the age of 4, my mother, who's an angel in the community, asked me, son, ¿qué quieres hacer cuando creces? And I looked at her and I said, Mom, well, what do you call others that help people like you? Like, what do you call people that help others like you? Because till this day, she delivers food. She gives the shirt off her back to anyone who needs one. And she was smart. She looked at me and she said, a doctor, mijo. Se llaman doctores. So ever since I was 4 years old, I said, I'm going to be a doctor to help others, just like my mom. And I made that promise, and to serve the community, the very same one that taught me so much about resiliency, hard work, and taking care of one another. And so when the time came for me to start applying for college, I faced a dilemma that may sound familiar to many of you. And how was I going to pay for it? So I remember my older brother was the first to graduate from high school, and he was the first to go to college. And then it was my turn, and my mother came to me and said, son, we don't know how we're going to be able to pay for 2 boys to go to college. And I said, oh no, I have to go to college because I got to go to medical school, and I'm going to be a doctor, and I got to come home and serve the community. And so I got up, I went to my dad's room. He was watching a baseball game late at night after a long day of work. And I said, Dad, I know you're stressed about how you're going to pay for school, but I'm going to help you. And of course, he looks at me like, what are you going to do? Because at the time I was sweeping the floors at a packing house, stacking boxes, earning minimum wage. And I said, I have an idea. And so I put on the one suit I own. It was this god-awful itchy blue suit. I bought it 2 sizes larger so I can grow into it. However, at the age of 17, nobody really told me I wasn't going to grow much anymore. So it fit me big and awkward. And I borrowed a briefcase, and I literally typed up a contract, how much my parents could afford, how much I'm getting in student aid, and how much I need for school. And I made copies at school. And when I say type, I actually used a typewriter because our high school didn't have computers then. Not because computers weren't around, it's just because we were a poor high school. And so I took those contracts, I went business to business, and I pull them out and I'd say, I'm offering you an opportunity to invest in your community by investing in my education, because I promise you, I will be a doctor and I will come home and serve the community. And so they gave me $50 here and there, $100, and I raised $2,000 that summer, which paid for like 2 years worth of school books, or my school books at UCLA undergrad. But what was more important than the money was that the community believed in me and invested in my dreams to come back and serve the community. And it reaffirmed the promise that I made to return and devote all of my strength, my skills, and education to becoming a doctor and serving others. So as Jeffrey said, I went to UCLA, I graduated magna cum laude, I went to Harvard Medical School, did a joint degree program with the Kennedy School, where I received master's in public policy. I did my internship in general surgery at Harvard, then my emergency medicine training at the University of Pittsburgh, went back to Harvard to do a fellowship in international emergency medicine, focusing on humanitarian disaster aid, where I got a master's in public health. And when I graduated, Harvard wrote an article saying that they believed that I was the first Latino to receive 3 graduate degrees from Harvard University. But I was true to my promise after I graduated in 2007 and came back home to the Coachella Valley to serve as an emergency physician in a nonprofit hospital. And the first thing that I did in my community advocacy was go back to those farm worker trailer parks to provide free care, free health education. It was 2009, we got hit by the H1N1 pandemic. So I led a flu vaccination program with promotoras into senior centers in our underserved areas. I worked with promotoras to develop a strategy to address the healthcare barriers. I helped start a free clinic in Indio, California. I was recruited to be a founding senior associate dean at the UC Riverside School of Medicine to create residency programs into underserved areas and create partnerships with community organizations. But when I was practicing in the emergency department, I was taking care of patients who were coming in with depression and anxiety during the recession, who were coming in with severe illness because they lost their health insurance and couldn't take care of their diabetes. I was mentoring, I started pre-med mentorship program with kids from underserved communities who wanted to be doctors and come back and serve their communities. And the students would come in tears saying that they had to defer school because Congress cut their Pell Grants and they couldn't afford their tuition. And seniors were very concerned that the plan in Congress at the time was to privatize Medicare, and they didn't know how they were gonna pay for school. And the level of poverty and pain and suffering that I saw in my childhood was still there. And so having a can-do attitude and an emergency physician approach, I decided to do something about it. My father always taught me, instead of complaining, do something about the problem. And so I decided to run for Congress. And you know, at the time, a lot of people didn't think I would win. In fact, there was a pollster. Before I tell you that, let me tell you that there are some local politicians who said, "Who the hell do you think you are? Why don't you wait your turn in line or run for school board, then city council, then mayor, then something, and work your way up to Congress?" And I looked at him and I said, with all due respect, I don't have to ask permission to serve the community. And I had been doing it throughout the years in the trenches with the people, taking care of them as a physician and public health expert, organizing in the community. And nobody really thought I could win. I got a pollster that came down from Sacramento, looked at the books of numbers that they carry with them and said that, you know, the governor, Jerry Brown, lost in that district. Senator Dianne Feinstein lost in that district. Senator Barbara Boxer lost in that district. And the last opponent against the Congresswoman had lost by 9-10 points. And so he closed the book and he looked at me and he said, "I have to be honest with you, you have a 5% chance of winning." And I looked at him and I said, "So you mean I can win?" So I took those 5% chance of winning with a can-do attitude and won by 6% that year. And I tell you all that because now I fight every day in Congress for a healthier, more equitable future for all. And I say this because every one of you has the same opportunity before you with LCHC. And it is now more important than ever that we must organize. We need to mobilize, not agonize, and we need to strategize. Our community needs us just like we need them. And right now we are emerging from the depths of a global pandemic that has weighed disproportionately on Hispanic, Latino, Latina communities. And throughout the pandemic, Latino, Latinas have been 2 times more likely to be hospitalized and 1.8 more likely to die from COVID-19 than any other groups. And as a result, we have seen the life expectancy for Latinos and Latinas decrease by 3 years. That's more than 4 times greater than the decrease in life expectancy of white communities. And on top of all that, Hispanic Americans felt the economic impacts of the pandemic most severely, especially Latinas, who are overrepresented in industries that were initially hurt most in the early days of this public health crisis. So they disproportionately had a decrease in their salary and their income, or disproportionately unemployed. And as a physician and as chair of the Congressional Hispanic Caucus, these statistics are deeply troubling. and only illuminate the urgency to act. Seeing the devastation this pandemic has wreaked on our communities, the Congressional Hispanic Caucus has pushed for an equity-centered approach to ensure that we wouldn't be left behind in our nation's recovery efforts. We advocated and unanimously voted for the American Rescue Plan to get shots in arms, money in pockets, kids in schools, and people in jobs. We also made sure that equity wasn't an afterthought. The same record that gets played in our work to address disparities is that policy is made, you see the disparities grow, and then those of us in this work complain and react to the growing disparities. And what we need to do, and what we've done in the Congressional Hispanic Caucus, is to ensure that equity is not an afterthought, but it is in the forefront of policy design. And it is in the front end of implementation, because equity doesn't happen on its own. It takes sweat, muscle, active design, intentionality to ensure that equity happens all the way from the federal level, state, community, local level to get things done. We cannot rely on a healthcare system that has produced the inequalities and the disparities and just fund it with the intention of equity to have equity. We need to redesign the delivery of health education and healthcare delivery into the community, taking care with the community to the people in the community. And so we fought for this kind of design in these different large pieces of legislation. For example, thanks to the provisions in the American Rescue Plan, where we expanded the child tax credit, 1.2 million Hispanic children were lifted out of poverty. And we pushed for collaboration with community-based organizations to get vaccines to our hardest to reach populations. In fact, seeing that nobody was really, as a physician, talking to the American people in English and Spanish, I got to work doing interviews from the beginning to explain what we know, what we don't know, and why we're recommending all the different precautionary measures. And when the vaccines came around, I led a meeting with all the executives of the retail pharmacies and really discussed their equity programs and explained to them that just selling vaccines or delivering vaccines in your pharmacy doesn't really solve the equity issue. And I warned them that what I did not want to see was the vaccines going to their higher income or higher profit stores as a way to reward their customers, but that 40% of the vaccines need to be in their stores with the higher social vulnerability indexes in those cities. And in addition to that, taking it one step further, because what we saw during the pandemic is that those that had more times in their homes, that weren't essential workers in grocery stores or other high-risk areas, who had good high-speed internet, were able to make reservations, identify where the vaccines are, and drive into those underserved cities and get the vaccines when people, farm workers who lived in those underserved areas, didn't have the time, didn't have the internet, and couldn't access or navigate a system to get those vaccines. So immediately we partnered with Rite Aid in the Coachella Valley, and we partnered with Promotoras, Community Health Organization, and vaccinated the people in trailer parks, in elementary schools, in churches. And I rolled up my sleeve, put on my stethoscope, went out there and started vaccinating people myself, even in the fields, to show that this kind of model can work. And I partnered also with the Free Clinic. We did street medicine under bridges, by the railroads, in the desert, and vaccinated our homeless folks. So we saw that this approach worked. We saw that when you invest in community health workers, when you invest in local organizations, you reduce the disparities of vaccination rates between Hispanics and non-Hispanic communities. The promotoras and community organizations work hand in hand with the pharmacies under Biden administration's federal retail pharmacy program to deliver these vaccines to the hardest hit, hardest to reach, most vulnerable populations in California and throughout our nation. And so now we're working to build on that success with the Inflation Reduction Act by expanding healthcare access to underserved and uninsured individuals. With its provisions to lower healthcare premiums, nearly 700,000 Latinos, Latinas will have health insurance coverage next year. In the Inflation Reduction Act, we cap on Medicare the cost of insulin to $35 a month. We cap the cost of medications to $2,000 a year. Some patients are paying up to $8,000. And we also allow Medicare to negotiate drug prices with pharmaceutical countries. So we're making progress in reducing the healthcare costs. So here in California, 1 in 5 Hispanic residents report not having a consistent source of care and experience difficulty finding a specialist. And so that's unacceptable. And we must work together to increase healthcare access across the board. We must build on our successes and take the same approach that we have taken throughout the pandemic to implement equity-based solutions to the challenges that we face. And this is where each and every one of you come in, because you are all a part of this work and you all hold the power to make a difference. You can use your voices, experiences, and expertise to advocate for a better, stronger, and healthier future, whether that be through bringing attention to an issue you see in your community, by writing an op-ed, holding a press conference to call for action, or organizing an advocacy meeting to push for a certain legislation. And now is the time to organize and mobilize, all the way from the local to the federal level. And I know that oftentimes in public health and medicine that we can feel trapped in our niche. We feel like we're comfortable in our own silos, in our own familia of public health, community organizing, public health work. And the fact is, though, that when we get involved in policy, we need to get involved in politics. And that when we understand the tools and the tricks and the trades of the policy and the politics, then we can get our funding, our resources, our priorities, our issues, our solutions in the forefront with decision makers. And you all understand and see the injustices our communities face because you all have lived them. We have lived them. We know how to break down barriers because we've overcome them. And we know what it takes to achieve health equity and social justice because we fight for it every single day. So I encourage you to keep using your voices to advocate for change. Make some noise, organize in your communities, run for office. I'm the first Latino doctor elected to Congress, and I certainly don't want to be the last. And I want each of you to take this to heart because I know that each and every one of you carries the burdens of the sick and the vulnerable. And that, like me, you dream of a future where your background, your zip code, and income do not determine your access to quality, affordable care or how long you live. So if you get involved, mobilize, and stay engaged, I know that together, under the banner of equity, under the banner of health and social justice, we will achieve health and social justice. So with that, I want to thank everybody for the work that you do, your tireless advocacy, believing in yourselves, the confidence that you have and the caring servant's heart that you have to go out, confront our most pressing public health issues. And our public health issues are not just the clean water, sanitation, housing, or the lack of illness, but it is the promotion of wellness and opportunity in our nation, in our communities. It is ensuring that we have good schools so that our kids can have opportunities in the future. It's ensuring that we have good jobs with health insurance that are safe and healthy to work in, to ensuring that our children have a better future than we do. So with that, I want to thank everybody, and I want to wish everybody a wonderful conference today.
Bravo. Thank you so much, Dr. Ruiz. It is such an honor to have you join us. Thank you for all the tireless work that you do, all those long days, long nights. We know that you are working so hard for our community, and we really appreciate it. Your work doesn't go unseen, unrecognized. We really appreciate it. And to hear your story, right? The luchador going out there and basically fundraising, right? For your journey, and it just means a lot. I think it goes to show the power of Latinos, right? Aunque no hay alguna forma directa, we figure out how to get it done, and that is part of the beauty of our culture. So thank you so much for joining us today and being part of the LCHC familia. So thank you.
Thank you. Good luck.
Thank you. Thank you. All right, folks, that was a beautiful start to our conversation today. I really appreciated what Dr. Reese shared around not having to ask permission to serve the community. That is why we are here today, right? We as individuals have that responsibility to use our platform, to use our roles, to use our privilege to serve others and to ensure that everyone around us, not just our loved ones, yes, our loved ones, but also folks that maybe we don't know, we need to pursue the health and well-being of everyone around us so that we can have dignified and healthy and joyful lives. All right, well, let us keep going. I would like to hand things over to our wonderful MC, Sandra. Bienvenida. It's so great to have you joining us on the second day and second year. It is so good to have you, and it's always such a joy to work with you and your team at Telemundo 52. So please tell us, what do we have in store today?
Thank you, Dr. Aquino. Thank you, everyone, for joining us today. Of course, it is an honor to represent Telemundo 52 and for Telemundo 52 to be part of this amazing opportunity, this second, year for me personally. But of course, you guys have been doing amazing job and work with our Latino community, just with these summits that are incredible. And thank you to the Latino Coalition for a Healthy California, Dr. Aquino, for your leadership, Dr. Reynoso, and of course, Dr. Ruiz, who, as you all heard, really inspires us. You know, son héroes, decimos en español, claro, con una capa imaginaria, pero para nosotros son héroes con capa, porque están ahí trabajando con nuestra comunidad. Cuando más los necesitamos, ahí están, a pesar de que él ya tiene otro trabajo de liderazgo también aquí en California. Pues le agradecemos. We thank you all for the job that you're doing, for the work that you're doing. And of course, equity takes leadership, it takes passion, it takes love for our community. And therefore, for us, it's an honor to be here today. And I also want to give you a few reminders because I want you to know that this summit is also in Spanish, and you can access the translations at the bottom of your screen, at the bottom of your window. That's one of the reminders. And I also want to let you know that after the panel, everyone who wishes to ask a question will be able to just put it in the chat. And if you would like to address it to a specific expert, please give the name as well. We will try to answer all the questions. The experts will also try to answer all the questions that come in through the chat. That would be after the panel, because to lead the panel is another wonderful person that has been working in the medical field for a long time as well. I would like to introduce you now to Berenice Núñez Constant. She's the Senior Vice President of Government Relations and Civic Engagement at Latinx Health Services Corporation. Leading healthcare system providing care for more than 300,000 Southern California residents. We've worked with Altamed too, Ms. Berenice, by the way. We do that often here at Telemundo 52. In her current role, she leads legislative and policy advocacy strategies aimed at advancing state initiatives to eliminate disparities in healthcare access and outcomes for Latino and multi-ethnic and underserved communities. Previously, Berenice was with Molina Healthcare, Inc., one of our nation's largest medical managed care health plans, for almost a decade, where she served as the Associate Vice President of Government Contracts. In that role, she led regulatory and advocacy strategies to initiate and advance state and federal initiatives to support the healthcare needs of underserved populations enrolled or eligible to enroll in government-sponsored programs. She also supported new business development expansion opportunities in current and prospective markets nationally. And further, she established the company's Latino legislative advocacy strategy to promote and advance policies for Latinos within Molina's national advocacy agenda. In 2010, Ms. Berenice was awarded a Health Policy Graduate Fellowship by the Congressional Hispanic Caucus Institute in Washington, D.C. During her fellowship, she worked in the Office of Health Reform at the U.S. Department of Health and Human Services, supporting the implementation of the Affordable Care Act, and at the Senate Committee on Finance, where her portfolio of work included Medicare, Medicaid, and oversight of federal health reform implementation activities. Collectively, Ms. Berenice has nearly 20 years of experience in the healthcare sector, working at the federal, national, as you heard, and state level to support the healthcare needs of underserved populations. She holds a Master's of Public Health in Management and Policy from the University of California, Los Angeles, UCLA, and a Bachelor's of Arts in Sociology from California State University, Long Beach. Impressive. Welcome, Ms. Berenice, and I know you will lead our panel of other experts as well. Welcome.
Thank you very much. Gosh, listening to that just makes me tired, but also just reminds me of all the work that we all have collectively done over the years to do our best in our kind of personal part to lead these changes. And so thank you for being here, for everyone for being here. I'm here in the role also as policy chair for the Latino Coalition for a Healthy California, which I have had the opportunity and privilege to be part of the board now for I think over 5 years. Correct me if I'm wrong, Jeff, but I think it's over 5 years. And so in that role also, I have really the privilege of having a hand in Latino policy initiatives that the organization is leading. And so that's really a personal privilege of mine. But today we're here to talk about civic engagement. And we know that the November elections are only weeks away, coming up in November, on November the 8th. And as I'm sure all of you have noticed through many of the campaign ads that have entered our lives, or not, right? Because we know that some communities don't receive the same information or are engaged in the same way. We also have a landscape of ever-changing health policy and the many attacks on voting rights that we've seen over the last few months at the national level. This makes it important for our community to be actively engaged on who they are choosing to represent us. This is especially impactful right now as we see the devastating fallout of the recent hate that has now made global news for the LA City Council, and as we recognize in real time that our voice is incredibly powerful, especially when it comes to deciding who should and shouldn't represent us in elected office. On a personal note, I mean, because this is happening in real time, I'm really truly compelled to say that though we are all sharing this collective heartbreak and anger, we also have the ability to do something about it. Those of us that are here on this panel today, those of you that are listening, we need to make sure that we are holding those that are representing us accountable. Right? We elect them into office. We have the power to keep them there, or we have the power to remove them. And so I invite us also, though, to do some inner reflection and work. Through this experience, I've been left kind of like holding the mirror up to myself and seeing, what have I done personally to build the bridge to other communities of color? Am I too centrally focused on what I advocate for every single day, which is Latino policy? And have I been complacent myself in these conversations that we have all or have not perhaps been part of? And what are we doing to really use our voice to individually stand against hate, but really to start looking forward and really doing our part to build collective power? And so I invite us all, as we approach this conversation, to think of it in that way. And as mentioned by Congressman Raul Ruiz, This is a Latino Coalition for a Healthy California. We are focused on Latino policy, and we know that throughout the pandemic, Latinos lost the most. We do not have to go past the data point of deaths to know that that is fact. And so we continue to see the devastation of this pandemic. For example, I want to call out the recent LA City homelessness count, the numbers in 2022. It is shocking to see that Latinos now make up 42% of the homeless population in Los Angeles. And this is an increase of 30% from just 2021. This is major. Talk about a public health crisis and what is coming as it relates to this tremendous surge in homelessness populations. And so let's start our timely and urgent conversation on how we are all working to ensure our elected officials are prioritizing Latinx health outcomes when developing laws, voting, and implementing health policies, but also how we must build and strengthen bridges to other communities to build this collective power. So allow me the honor of introducing our wonderful panel that is here with us today. We have Lizette Escobedo, who is the Associate Vice President of Civic Engagement and Advocacy at Ultimed. Welcome, Lizette. We have Timmy Liu, which is the Founding Director of AAPI Force. Welcome, Timmy. We have Rakiba Labrie. Is that how you pronounce your name? Rakiba Labrie, Vice President of Programs of the San Francisco Foundation. And then we have Raul Macias from the Haas Jr. Foundation. So welcome, everyone. I'm so excited to have this conversation, and I just look forward to the questions from our audience as well as we kind of carry out this very important topic. So for everyone, right? So to get us started, I want to discuss what civic engagement means to each of you and why each of you believe it is key to increase civic engagement across communities of color to ensure we can achieve the justice we all deserve. And so with that, I'll just go in the order that I listed the panel. I'll go ahead and start us off with Lizette Escobedo.
Awesome. Thank you so much, Beta. And I'm so excited to be here today, this morning, especially amid everything going on. I think this is a perfect conversation. To me, for me, civic engagement really meant initially an opportunity to incorporate my parents in a meaningful way in this country. Both immigrated from Mexico, both didn't understand how to navigate the counties, the cities, the state, the federal. It was just a convoluted kind of web of offices and bureaucracy. And so, starting early at 10 years old, translating, interpreting, right, like many of us did, I quickly understood that there was a lot of need for changes in institutions and how our government functions. And so, at a very young age, about 20 years ago, I kind of engaged in this process of how do we change the government institutions, our laws from the core. And for me, I saw that as civic engagement, right? Making sure that our communities are constantly voting at a high propensity, making sure that they have the information to vote, especially with a voting system, even in the state of California, right, that is extremely complicated and feels almost designed to exclude folks who might not understand it very well. And so as I engaged in that journey, I just noticed all these, understanding the ballot and understanding when the dates are, understanding local elections versus midterm versus federal or presidential elections became very important. That kind of led me into the census, right? Big opportunity to get funding and representation at the core for the next 10 years in our community. And then realizing that we weren't there. We weren't at the table. Latinos were the most undercounted, lived in the most undercounted census tracts since, the 80s, the count in the 80s. And so, for me, it really just meant the opportunity to integrate our community fully in the democratic process, which leads to many institutional, system, legislative, and leadership changes in our country and in our local communities as well.
Thank you, Lizette, for that. I'm going to hand over the mic to Timmy.
Yeah, thanks for the invitation, and just really excited to be on this panel with Rakiba and Raul, who's personally and their institutions have also been long supporters of our work too. And so I think what Lisette shared, it made me think about too, like my first experience voting. It was 1992, and I voted for Bill Clinton twice. And I did that because I voted for my parents. Right, like at the age of 10, I was our household's political director and policy director. Right, like they as like new refugees, new citizens, like they really wanted to get it right, but they also wanted to support candidates that supported working class communities, poor folks like they did. Right, and so they had me analyze the ballot and all of that. Right, and so I know that's a common story, right? But fast forward a bunch of years, like, why civic engagement is important to me. One of my mentors, his name is Torm Nompersert. He was one of the first families who came to the US from Laos and was resettled in Richmond, California. If you don't know anything about Richmond, California, it's the home of the Chevron Corporation and the refinery. And it's the corporation's been in the city for longer than the city's been a city. Right. And one of the things, one of the dynamics and things that I learned from Torm as an organizer was that if you're not a participant in democracy, then it's very easy to become a victim of democracy. Right. And in a town, in a city, and in my past work at APEN Action, like we realized that environmental justice, environmental health were intricately linked to civic engagement. Right. And so when you have this corporation who's been polluting unchecked in the city for over 100 years, that impacts the city's Black, Latinx, Southeast Asian, refugee, and immigrant communities. Right. And so if we start to think about like the impacts of health, right, like we also have to talk about health at the point of consumption of healthcare, but also like in our lives, right, the sort of ecosystem. And so a big part of, for myself, understanding the impact and role of civic engagement in democracy was actually working through our C4 organization, APEN Action, in collaboration with labor and other community organizations, right, to reduce the impact of corporations like Chevron in local elections in Richmond. And a part of it for me was really learning through that process, right, that if our community is not engaged, then it's politics as usual. And politics as usual, it means the undue influence of money on elections and the preservation of power and self-interest, right? Which, I think it's not lost on me that the crisis in the LA City Council was prompted by a conversation about redistricting, right? Like in politics, some of the most vicious political fights come around about that, because it is about like people's like livelihoods, right? Like your position of power and privilege, right? Your ability you may feel like your ability to deliver for your people and constituencies and communities, right? But what happens if those types of conversations turn the way that they did in the audio tapes, right? And so I don't have a good answer for that, right? But I do have a model for what it looks like to build a multiracial democracy. And it was in those campaigns that I worked in Richmond, California, that united where Black and Latinx and Southeast Asian folks got together shoulder to shoulder to work in preservation of their own health, but also to understand each other through that work and through that community building, right? That like our interests are shared and we can't advance without advancing together. And through that, like share our cultures and foods and our like, local knowledge, right? And even so, if sort of in these moments, right, where I, for myself, become so politically cynical, like I come back to that place, right, that we are stronger and ought to advance and come together, right? And that's how we counter some of the very cynical politics that we're seeing, right? So, anyways, I just, yeah.
Thank you, Timmy. And
I'm
of
very
course,
mad about things too.
I know
like,
it. I know it. And I always like to, it's all really tough and heavy, but I always like to bring lightness to the conversation. So let's start, building the bridges through food. I like that approach, right? That's such a unifier as well. And so thank you for those comments, Timmy. So I'm going to go ahead and hand it over to Rakiba.
Thank you, Berenice, and thank you to LCHC for inviting me to be on this panel with the civic engagement luminaries. I want to give particular expressions of love to Dr. Cecia Aquino and Dr. Jeffrey Reynoso, who have been wonderful partners to me and my work. And I've worked in philanthropy for over 20 years, but I am not a civic engagement expert. I've worked across a range of social justice issues. So whatever I've learned from the experts like Raul and Timmy. So big shout out to them as well. In terms of civic engagement, I think of it as including but not limited to voting. I think because so many of us as people of color are sent messages in different ways that we do not belong, that this is not our country, that civic engagement is an assertion of our belonging, of our ownership of this country, of our communities, and that we will not let multiracial democracy be subverted by people's interest in putting white supremacy over democracy. And so I think it's about shaping our communities, doing the kind of bridge building work at the local level that Timmy describes, and standing up against multinational corporations that are threatening our well-being, the well-being of our children, and having a voice in local politics. It's doing that kind of breaking of bread together to learn about one another's stories. I feel like those have been powerful building blocks in engaging what folks are now calling transformative solidarity, where we come together across lines of difference, across race and class and migration story, to see our shared interest in building communities that nurture us all and foster that kind of inclusion and belonging. And so I see that it's about voting as one exercise of voice and power, but it's also about local organizing on issues that are urgent for communities, and that kind of long-term power building that goes on in between and beyond election cycles.
Thank you for that. Raul?
Yeah, thank you. I would really, well, echo what everyone has said. And Rakiva, I had a similar message. I mean, for me, civic engagement is the lifeblood of our democracy. And we can't have a thriving democracy without an engaged public. And for me, civic engagement, it means more than voting once or twice a year. It's also, and certainly, not everyone can vote, and that doesn't mean that they can't be civically engaged. And we still need to find ways, all of us, those who can vote and those who can't, to be civically engaged year round. And as Representative Ruiz was giving us great examples, civic engagement doesn't have to be strictly political. There are other ways to support your community and build your community up, and to be involved through volunteering and service. And but I do think it's also, as Rakiva was pointing to, and Timmy and Lizette, that it is critical for that we have civic engagement at the local level, monitoring our government year round, and making our governing bodies accountable. And they serve us best when they are accountable to our communities, and when the communities are involved and giving input and monitoring what they're doing, and making sure that they're holding up their end to us. And so, and I've been thinking about it a lot this week, watching this play out in real time, what really powerful civic engagement looks like at a local level in LA, as we're watching these incredible protesters and activists that are going to these meetings in LA and calling out racism and injustice and seeking accountability from the people who are supposed to be their leaders. And I think watching that, I've been especially proud and happy to see that there's been cross-racial allyship, and that at those protests, and ultimately I think it's that kind of activism that's going to build the pressure that is going to hopefully pressure change, both in the membership of the city council there, but also longer term structural changes that we see are needed, and hopefully that kind of activism and civic engagement that's going to also help those communities heal, and to rebuild trust and rebuild community that needs to be done there. So that's what civic engagement looks like to me too.
Yeah, thank you for that. And thank you, panel. and our experts on this. I think it's a beautiful frame to take us through, I think, into some of the deeper questions. I want to pivot us here to, I think about, on the healthcare front, right? I'm my day job and my 9 to whenever is really, really centered on healthcare and social justice and access to quality care, right, at Ultimate Health Services. And so through that lens, we try to approach civic engagement as a social determinant of health, as a determinant of social justice in a community. And so I also strongly believe that institutions, especially the large ones, have a responsibility to do what they can to engage their staff, community members, et cetera, on civic engagement issues. I also agree with you, Rakiba, that this is through the lens of not only voting, but all the issues that impact our communities, right, in order or impede their forward movement, their success, their well-being, et cetera. And so for Lizette, can you tell us about some successful strategies you and the team at Ultimate have used to increase voter engagement and really civic engagement more broadly within the communities that we serve?
Sure. So I'll start off, Bere, with just sharing, a quick little story about I was, prior to coming on board with Ultimate, I was with Naleo for a couple of years, running their national civic engagement work. And when actually Bere approached me to come on board with Ultimate, I was like, civic engagement and health, and I was trying, and then it quickly clicked for me, right? The health of our community really relies on policies and leaders that are going to push for healthy communities, right? And so one of the things that we did in terms of our programs and really assessing the need there is when we map out all of our community health centers for Ultimate in both Orange County and LA County, and you overlay that with the hardest to count communities, and then you overlay that by the highest density of low propensity Latino voters, we are at the epicenter of each of those, which made it very clear for me that in order to make our communities fully healthy once they leave the exam room, we had to make them healthy in their democracy as well and engaging them in the civic work. And so what we decided to embark on, and of course with the support of our CEO and with leadership, is looking at all the opportunities we have to reach community members, which would be our patients, right? Which we have over 300,000 of them. Every opportunity we have to reach our staff, which we have 3,500 of them, and they all come from the communities that we serve. And then an opportunity to reach the surrounding communities in which we provide services. And so we, in essence, developed a model for not just engaging patient staff, but also engaging community. And so what we've done with our community health centers is in essence made them into civic engagement hubs. And so if you go to any of our clinics now, you can find voter registration forms, you can find information about the upcoming elections, posters, videos in the lobby area, screensavers, really just accessible information for them. We just partnered actually with the League of Women Voters to provide easy voter guides in both English and Spanish that are co-branded with My Vote, My Health. Those are available at all of our community health centers as well. So that in every opportunity that we have to talk to a patient, we're talking to them about what I keep calling kind of the continuum of health, which includes civic engagement, right? We've also engaged our physicians. We are working on a program of 100 physicians with 100 voter registration badges that have a QR code, so that as they're kind of giving the final note to the patient, here are the medications, here's the after visit summary. Do you want to scan this QR code to register to vote online? We're actively doing that now and actually onboarding folks. With our staff, we have staff-wide communication that really hones in on, do you know when election date is? Do you know that the voter registration deadline is October 24th, et cetera? And really answering their questions, right? Because we know that they can become influencers in their community. And then the last piece is we actually run a traditional Get Out the Vote program within a 5-mile radius of each of our community health centers. We recruit from our staff, from community, to do phones, to do doors, and to do texting. during the same kind of GOTV timeline to make sure that as patients and as staff members go back into the community itself is also engaged in what is the upcoming civic engagement topic. And so that creates, in essence, civic engagement hubs that are not just our clinic, but are that entire community surrounding our clinic and creating hopefully healthy communities in the long run that way. So for the primary election, our goal was to engage 200,000 new and low propensity Latino voters. We actually ended up engaging 209,000, so we surpassed our goal. We're doing 272,000 this time around for the general election, with an oversampling of Latina voters, because the other big piece, and I'm sure we all know this already anecdotally, but through various sources, this has been proven right through data, that if Latinas vote in the household, it's likely that that entire household will be engaged in voting. And so we've engaged all of our community health centers with women's services to provide information on voting. We have, if you guys see here, my Mujeres Vote button. These are provided to all of our women's health services as well. And also because women's health is on the ballot this election, which is very important, right? And so these strategies have really helped us to get our community that we serve acquainted with the importance of civic engagement, the language of civic engagement, and just getting that dialogue started amongst our patients, our staff, and the communities within our service area. And our hope is to, and we've been doing this, to take this model to other community health centers, which we've been doing across the state and nationally, actually, through a recent partnership with Vote ER as well.
Thank you. Thank you for that, Lizette. I'm going to bring Timmy into the conversation because I think we all understand that too often when these elections are coming up and it's time to vote, like it takes the campaigns so long to really prioritize us and engage us until it's too late, right? The election is around the corner. And then we get this like, you know, kind of surge of resources into the community, but we need more time to do really impactful work. And so, so when it comes to voting, Timmy, and civic engagement, what are the ways that we can change the narrative to get more of our people involved earlier on or off cycles? And this is both externally and within our communities.
Yeah, thanks for that question, and also for the answers to that question too, because I mean you named it right there. That are like civic engagement, and right, Ronald Cooper had named this as well. Civic engagement is a year-round affair, right? And if you are talking about engaging communities that have been historically excluded or actively excluded from politics now, you can't just do that within like the 4-week cycle before election day, right? Like it's just not possible to do that. And I think it's important if we're talking about like, you know, what's holding us back, right, is to really think about what are we up against, right? Like we're up against like a political structure that has largely treated our communities as invisible, right? And when we have become visible, it's only because they're treating us in a transactional way as a winning margin, right? And so then you see candidates swooping in and like, you know, in the case of AAPI, showing up and drinking boba and like, you know, pretending that's enough, right? Without engaging on your issues. And so I think it's important for us to think about like, okay, if being invisible is of course like not enough, like being just a winning margin, right? Because if you're just a margin, then it's easily to be treated as marginal in your politics, right? That our counter that is to understand that, and we know this through our organizing, is that every participant is a leader. Some of the most powerful and incredible leaders that I've ever worked with, I've met on the doors. Like they weren't engaged in politics or in organizations before, but because somebody took the time to knock on their door and understand and hear what their issues were and give them space, you know, and also to feel powerful through that process, right? That there's an opening there. And I think a couple of things I want to address too, if we're talking about the narrative and engagement in politics, is like there's a lot of discussion right now amongst not just in Asian American communities, but I know in other communities of the color too, around disinformation impacting our communities and some of the kind of far right and extremist organizing happening, right? And in my opinion, like, you know, we can try to argue with people on the internet all day, right? But the real solution is that we organize our communities, right? And we engage people in politics in a way. Like disinformation and propaganda breeds in places where people are disengaged or not in community, right? And so, so I think this is a big part of why API Force is a part of coalitions like the Million Voters Project, and we work really closely with allies like Churla Action and the California Black Power Network, right? As organizations that organize in multiracial spaces, right? That that we are building organizations that look like the communities that our people live in, right? So just thinking again around like, you know, changing this narrative, right? Like a core part of it is that like others have shared, that we invest in organizing and engaging people in a deep sort of way, right? That's deeper than the sort of drop-in sort of campaigns that that basically, you know, treat our people as just voters, right? Because we know, as others have shared, civic engagement goes deeper and more broad than just the voting aspect.
Yeah. Thank you, Timmy. I think that's the perfect segue into bringing our philanthropic partners here into the conversation. So, Rakiba, in your experiences, what types of projects or campaigns are the most successful, not only in both creating and or increasing voter engagement?
Thank you for that. And so I think there are markers of successful projects that I want to highlight. So first, as Timmy suggested, they pinpoint who are the credible messengers, who are people actually going to listen to when it comes to voting. And it's interesting what Lisette said about Las Mujeres, because I remember talking to Arturo Vargas, who's the CEO of Naleo, and he said they had done focus groups, and this was many years ago, asking Latino men, who do you listen to when it comes to voting? And they said their mothers or their wives or their girlfriends. And I was thinking, I don't know if I should share it because maybe it's dated, but I guess it still holds true. So we have to invest in Latinas as promotoras to get the word out, since we know they hold the power. And it's interesting because foundations invest a lot of money in polling and doing this research, but the knowledge is in the community. So we should just act upon the wisdom of the community. That said, there can be those targeted campaigns, but I have another funny story. So the Othering and Belonging Institute at UC Berkeley, John Powell's institute, they did a campaign to try and activate young Black men, and they used a kind of hip hop theme, which I hope they did in a not patronizing way. And they played it with Black men, young men, it didn't resonate so well, but when they shared it with Latinx young men, it resonated really well. And it acknowledges the intersectional identities we hold, like some Latinx people are Black and vice versa. And so the targeting becomes complicated when you have an intersectional analysis. Then I was thinking of what we've talked about earlier, that civic engagement goes beyond voting. And I thought of a case study from right here in Oakland, California, where I sit and live. And so here there's a organizing group called the Black Organizing Project that started with the issues that were most front and center for Black and Brown communities here. And there was a real concern about getting police out of the public school system. And so they organized a 10-year-long campaign and activated people to show that they could change conditions in their community. They succeeded in getting police out of OUSD. And as they did that, they activated people as voters locally to sort of weigh in on local races. And I think that taste of power and influence then can build to get people more engaged and weighing in on state and national races. And I think the last thing I want to say is we have to acknowledge that we as communities of color have different political homes. Like if I were to go to my aunt or my grandmother and say, oh, you should join the League of Women Voters, they'd be like, huh? Like that doesn't, it's not in our consciousness. Even though the League of Women Voters is doing powerful work and I support them and have funded them. And so for my aunt who goes to church, the church is her political home. For my cousin who has
who is now stably housed, but has at times been unhoused, the Salvation Army was the place that activated him. So it's for some of my more bougie Black friends, it's their fraternities and sororities. So, we just have to think about what are the political homes where we gather, and it's not always the obvious places that conventional civic engagement types think of.
Right. Thank you for that. And in these last few minutes, we'll take it through about 10-15 or so. I want to bring in Raul. Raul, we're talking about, obviously, in your role with foundations, and we're talking about this on and off cycle engagement, and how important is that? And so how important that is. And so how should foundations just generally engage in the civic engagement work, and maybe why should they, for those that don't? And then what are the strategies on and off election cycles that need to be implemented? Raul?
Thank you. Okay, there's a lot there. I mean, I would hope for funders, if there's funders out there, that encourage everyone to think about funding civic engagement and voter engagement work. It's been mentioned before, but if you want to see whatever your focus area is, if it is on health and you want to see the policy changes, then we need civic engagement at the local level to engage our communities, to hold their leaders accountable and to develop leadership. That's the kind of work we are funding. The kind of work Timmy described before, the year-round integrated voter engagement work, building multiracial coalitions at the local and state level. In terms of the off cycle, I mean, first, I hope folks get some rest. They're coming off census work, presidential election, a recall, a year of redistricting work.
For rest would be helpful.
Yeah. Yeah, that's true. Well, I'm about to name all the things we hope they'll work on in the off cycle too. But there's a ton of the redistricting and now the midterms. It's been a lot. But I do think the off year is an important time also to evaluate what's happened and what we can learn from it and how we can do better. And I was thinking, just on the voting side, the state has adopted a ton of election reforms and just is. Lizette mentioned how complicated it can be, and it's true. We have different models across county lines. We have, the state has adopted automatic voter registration, the Voters' Choice Act, universal vote by mail, and has done very, very little to actually fund voter education, to explain to people all of these changes. And we know through surveys of voters, most voters don't realize all the changes that have happened. And so I do think taking the time to look at some of that work and how it's working for us is important. And we have to look beyond just scoring it, well, turnout went up or turnout went down, because that's not enough. We need to look within that across demographics at how these systems are working for our communities. And we know, the research suggests in 2020 that yes, turnout went up, even across demographics, turnout went up, but we actually saw widening participation gaps, that white voters were voting at a higher level than Black, API, and Latino voters. So we wind up with higher turnout, but an even less representative electorate, and that's not success. We can't pat ourselves on the back and say, well, turnout is up. We actually need to look at our systems and see if we're getting a more representative electorate or not. There was some good research from PPIC and the Center for Inclusive Democracy looking at one of those reforms, the Voters' Choice Act, where counties are allowed to significantly decrease the number of polling places that they use. They adopt something called vote centers instead, which have great benefits. They're open every day for more days, and voters can access them early, before the election. But it's a significant cutback in the number of locations, by about 90% of the number of or 90% fewer locations than traditional polling places. And when you're not doing a lot of education work to let people know, you don't have the kind of trusted messengers that Rakiva is talking about aren't being funded to go out there and
right.
remind people that their polling places aren't there anymore. It can hurt voters, and Latino voters have traditionally voted in person more often than other voters. And so the research from PPIC and Center for Inclusive Democracy showed just that yes, turnout increased in those counties, but the participation gap widened between both Black and Latino voters compared to white voters. And so we need to look at these reforms and make sure they're working for us and what we can do more. Just a couple of quick things.
I'm gonna ask you to wrap up just because it's 10:15 and I see Cecia and now Rosa on the screen here with us. But thank you so much. I mean, I think, you know, and I'm sorry to have to do that, but there is a ton here, right? And so I think that we, hopefully everyone here, our experts and our audience is really kind of walking away with, you know, the fact that we can all do something. And I think that we all have the responsibility to do something. And so leveraging our lived experience, our employer, where we work, even our families, our matriarchs, our head of households, the time is now. And I think we have, you know, not only with the recent happenings, but what we've seen throughout the pandemic, I think we have the fuel that we need to carry us forward in this space. And so again, I invite you all to think of civic engagement, not only as voting, but really as this social determinant of health, as determinant of civic health in our communities, and really overall kind of the fuel for social justice and the change we want to see in the communities. And so thank you to our panelists. It's been an amazing conversation. And to the Latino Coalition of Healthy California, please, you know, just accept our thanks on creating space for this important conversation. And so with that, I'll go ahead and just remind everyone to stay on for the live stream of our second panel, which starts shortly, on the future of health for all. Back to you, Cecia.
Thank you. I'll pass it to Sandra. Thank you so much.
Thank you, Dr. Aquino. Thank you, everybody. Oh my goodness, I learned a lot, as always, as yesterday I did as well in the other panel. Thank you, of course, Ms. Berenice, Lisette, Timmy, Ms. Rakiba, Raul, for all your insight and just all your experiences with our community and everything that you're doing. And of course, I also thank all the organizing team, Ms. Cecia Aquino, obviously the Latino Coalition for Healthy California. I couldn't be more proud to be part of this event. Thank you for inviting us. On behalf of Telemundo 52, I invite you to continue to stay engaged. Of course, we will do our part as media to connect with all of you. I will put my email in the chat box. Send me ideas. I would love to turn them into news reports, as we have been doing throughout this time, and elections are coming. So the stories will also be focused on that, besides the much needed health topics. So thank you very much, Lisette Carvajal and Ceci Hatiba Makim on our community relations. I appreciate all your support and your invitation. And of course, to the Latino Coalition, congratulations on this amazing event. And I leave you with Dr. Aquino.
Muchísimas gracias, Sandra. I really, really appreciate you and your team. Thank you for your support. It makes such a huge difference to have you in your role being that trusted messenger to our comunidad. And so thank you so much for doing that. It's such an honor to have you with us. All right, well, let us continue. It is my pleasure to introduce you to our next panel, the future of health for all. And we have an amazing group of panelists and experts. Thank you all for joining us. In the next panel, we will be talking about the future of the Health for All campaign. We have had many wins, right? And we are at a good place, but there is much to be done yet. And so in our conversation today, we will be talking about a little bit of history, where we've been, but also where we're going and where we're going as a collective, because like we've discussed, we are stronger together. I will introduce our wonderful moderator, Kate Jones, who is the Legislative Director for State Assembly Member Arambula. Kay completed their undergraduate studies at Ohio State University and received their doctorate in neuroscience from the University of Missouri. They continued to research autism spectrum disorders at the University of California, Davis, before transitioning to the world of policymaking at the Capitol Office of State Senator Dr. Richard Pan. Now, in their capacity as Legislative Director, Kay has been a champion of the Health for All expansion and is a true subject matter expert. We are very lucky to have them with us today, and it is my privilege, Kay, to introduce you and welcome you to our conversation today. Thanks for being with us.
Of course, and thank you so much for that warm welcome. Hello, everybody, as said, and welcome to the Future of Health for All panel. My name is Dr. Kay Jones, and I'm the Legislative Director of Assembly Member Dr. Joaquin Arambula, one of the Health for All champions for the California State Legislature. Before we start with today's panel, I'm going to briefly go through some housekeeping items. Regarding language accessibility, we are providing interpretation in both Spanish and American Sign Languages. If you have not already accessed these language channels, when you log in, please indicate in the chat box and we will transfer you to the appropriate channel. At the end of this morning's panel, you'll have an opportunity to submit questions to all the panelists via the chat box on your screen. Just make sure to indicate which of the panelists you would like the questions to be directed to, or if you want them to be to everybody. We'll do our best to combine and get to as many questions as we can today. So without further ado, let's get to the Future of Health for All panel. In the last decade, the Health for All campaign has advanced justice for everybody in the state of California, regardless of immigration status. Everyone deserves to have a long and healthy life, and that requires the basic right of access to healthcare. Not only has the Health for All campaign advanced health equity, but it's also changed the immigrant narrative in California and across the country. And thanks to this incredible work, we're one step closer to true universal healthcare. And now that we've been able to cover that last remaining age group of 26 to 49 years of age, expected to go in effect on January 1, 2024, we have a question. Where do we go from here? So I now have the privilege of introducing today's amazing panel, and thank you so much to everybody for being part of this. We'll start with Cynthia Buiza, the Executive Director of the California Immigrant Policy Center. No, Cynthia, if you want to wave. We have a wonderful practicing promotora, Enriqueta Medina, with us as well. Really appreciate joining and giving that perspective. JC Cooper, the Chief Deputy Director of Healthcare Programs and State Medicaid Director with the Department of Healthcare Services. And finally, but not least, Marisol Avina, Director of Public Affairs and Communications with the California Endowment. To get us started, sorry, Zoom's always still trying to figure out for me how to moderate a panel, so everyone please bear with me. To get us started, we really want to acknowledge, as mentioned before, this power of collaboration, because we cannot continue to be operating in silos anymore. We are stronger together. And that Health for All campaign is a true testament to that powerful collaboration across the state. So starting with Cynthia, can you share with us the story of the Health for All campaign, walking us through what we've been able to accomplish in the past decade and the phased population wins to what got us to us now?
First, thank you, Kay. Good morning, everyone. Good morning to the participants of this conference. As you pointed out earlier, Kay, it's very, very important to acknowledge the partnership that we have had with the LCHC and its members throughout the years, because I'm going to point out that this is a multi-year campaign. It took us almost 10 years to get to what's going to happen in 2024, right? Which is the expansion for everyone. But I would be remiss if I don't acknowledge the great work that the coalition has undertaken to get us here. We need to celebrate this major victory because it's historic. We're now the only state in the country that's going to do this for our undocumented communities. And if you don't think yet that it's a big deal, I encourage you to think about it now. This is a big deal, and we're not always great at celebrating our victories because we move on to the next important thing. This is the next important thing. So let's sit with that for a minute, and also just really acknowledge the centrality of directly impacted communities who journeyed with us from the beginning of this campaign up to today, and who will continue to journey with us as we try to complete this vision for Health for All. So a little bit on the history, it's a long one. I'm gonna later paste something in the chat so that folks can follow the chronology. But right now, I just wanna say that this campaign really started in 2014. And it started in the wake of the campaign around the Affordable Care Act at that time, where what happened with ACA is basically it excluded undocumented immigrants. And if you look at when we looked at the remaining uninsured, they were part of that population. So what we did along with Health Access, our campaign partner, was really to mobilize around the necessity to ensure that this glaring disparity is addressed. And it has always, I want to point out that the campaign really always expressly included everyone. We never sought a phased-in approach. And the decision to start with just covering kids up to age 18 was then Governor Jerry Brown's decision, not ours. At the time, our champions, former Senator Ricardo Lara, along with our co-chair Health Access and the Health for All Coalition, forged ahead, continued the messaging around fighting for everyone, even as we agreed that we can start with coverage for kids. So I also want to point out that it's the role of the young advocates here is very important. At some point in the campaign, a lot of directly impacted undocumented young people told us, we're tired of being put in the pedestal. We're tired of being told that, that we're more important than our parents. So this is where actually both the young adults as well as the seniors proposals came into being. So as we started with kids and then with young adults and then with seniors, we started seeing that the incremental approach was also working. But during that period, we never wavered on the messaging around we need a health for all. So I want to make sure that all over this 8-year history of this campaign, it was a both and campaign in many ways. While we were basically agreeing to what was politically viable, and we also never lost the eye on the prize that it's not a health for all if not everyone, if everyone is not included.
Excellent response. And kind of going along that, how did the narrative around immigrants change from day one until now?
We were very deliberate in our strategic communications work. Can you hear me? Sorry, it's saying that my internet connection is unstable, and whenever that happens, I start getting nervous. As long as you can hear me and see me, I'll keep going.
Yes.
Yeah, so as I was pointing out earlier, we were very deliberate in integrating a strategic communications work for this campaign. And we have a lot of partners in this room who played a role in that, including the California Endowment, who really made sure that we had resources for the strategic communications work. But the reason for that is we knew we needed to shift not only the public opinion, what Californians thought about this campaign, but also elected officials and our champions who were helping carry the torch for us in the legislature. So I'll give you a few examples of how some of those messaging strategies came to be and was consistently carried on throughout the years. In the framework of For All, right? In the framework of inclusivity, we really made it clear that undocumented immigrants are Californians. They are our neighbors, they are our brothers and sisters, they are our tios and tias, they are our uncles, and they are our friends. So people who are working and living their daily lives in California like everyone else. The fact that they don't have documentations or a pathway to obtain them is not a failure of themselves, but a failure of the system that we live in. So it was very important to communicate that and make sure that we also highlight how important it is that this disparity around a population that doesn't have access to healthcare was clearly understood by the public. We also completely flipped the false narrative that undocumented immigrants are takers, that they just, take things from other people, presenting that we know to be simple facts, what we know to be simple facts about how they contribute in so many ways to our economy and the social and cultural fabric of our state. We also honed in on messaging that healthcare is a scarce resource In fact, our healthcare system functions more effectively and efficiently when everyone is covered. And one of the more powerful ways that we really shifted not only public opinion, but also both empathy and support, not just by our legislative champions, by the public, was centering the stories and experiences of directly impacted population. If one looks at the history of this campaign, as I said earlier, we made sure that we weren't, as advocates, speaking on behalf of the community, that we made sure that the population who had the greatest stake in the outcomes played a central role in how this campaign was going to be talked about, was going to be communicated, and ultimately, as I will address later, how it's going to be implemented. So it's important as the stories we tell matter. And we prove that an example like the Health for All campaign, what otherwise would have been such a weedy policy conversation, translated into a human and humane conversation, centering the immigrant individual as well as the need for a state that prouds itself as intending to be a state for all, that it included this population that have been marginalized for a long time.
So wonderful here, and it's always so great to hear the history of all those wins, but also how to keep the message central and on point and keep everybody focused on the human aspect and the humane. Along those lines, Enriqueta, I would love to hear more about what Health for All means to you.
¿Puedo hablar en español? Ok. Hola, muy buenos días a todas. Gracias por invitarme a participar en este panel. Importante para escuchar no solamente mi opinión, pero la experiencia de mucha comunidad. Tengo 18 años trabajando como líder comunitaria voluntaria en la comunidad del norte de San Diego, y las experiencias que hemos encontrado son muchísimas. Es parte de mí lo que ha traído un regocijo a mi familia también, el tener acceso a este servicio de salud. Y curiosamente tengo amigas que tienen 49 años de edad y tristemente ellas dicen, yo no puedo, pero el próximo año sí. Eso es una esperanza para ellas. El saber que tienen la posibilidad de recibir servicios especializados, de verdad, la economía no se vea afectada por este impacto de acudir a servicios de emergencia muchas veces para atender sus necesidades. El hecho de haber obtenido de una manera muy fácil, accesible, con mucha información y sobre todo con personas capacitadas que me guiaron para poder lograr este programa, para mí y mi familia fue un paso adelante en mi salud y en mi futuro. Porque de alguna manera el hecho de saber que puedo acudir a los servicios, no solamente de consulta primaria, pero de especialistas, y que más personas van a multiplicar este servicio hacia la comunidad, hace una gran diferencia, un buen impacto en nuestra comunidad. Y contar mi propia experiencia a otras familias da la oportunidad para que ellos también se integren. Sobre todo, nosotros trabajamos como voluntarios en organizaciones con los trabajadores del campo. Muchos de ellos no tenían conocimiento, no sabían cómo hacerlo, ni tampoco que podían acceder de manera fácil, muy sencilla, y que la forma en que ellos están viviendo es un poco de alto riesgo, más que cualquier otra persona. Es importante que se haga este enlace para la comunidad. Ha sido algo maravilloso. Para nosotros fue una felicidad muy grande recibir esta noticia, pero también el trabajo de la comunidad organizada, porque nosotros asistimos a Sacramento para solicitar a través de las organizaciones que fuera algo viable para nosotros, acceso a la salud, acceso a la prevención, acceso a la participación activa en la comunidad nos lleva al aprendizaje y al conocimiento, y también para invitar más personas que participen y se hacen forma más grande, se ve la realidad de nuestra vida y ese impacto se puede dar directamente a los representantes en el Congreso, en el Senado y localmente a los consejeros que sean en nuestras comunidades. Ha sido algo grandioso, un logro muy grande, la verdad. También quiero agregar un poquito sobre el hecho de haber tenido nosotros la posibilidad de recibir de primera mano capacitación hacia esa área. Organizaciones como Derechos Humanos, por ejemplo, lo que están mencionando ahorita, el derecho a la votación, eso implementa un brazo extra, porque los derechos humanos implica vivienda, salud, educación, un trabajo seguro, pero sobre todo el derecho a participar activamente y con libertad en nuestro país. Eso es importante para nosotros saber que un paso muy grande y saber que hay personas que, aunque no cumplan los 50 años para arriba, van a tener acceso a esto. Es maravilloso, es increíblemente un beneficio grande que las personas creemos que lo hemos logrado, pero es algo que merece la comunidad en cualquier país. Salud, el acceso a la salud, a los servicios médicos, sobre todo las personas que tenían enfermedades crónicas, que eran limitados en el pasado. No podían accesar a un servicio de continuidad o de asistencia. Tenían que solventar esos gastos muy, muy grandes. Y parte de nuestra gente que ya está mayor, lo que reciben de pensión no era nada, solamente era para las medicinas o la comida, que era una gran disyuntiva y ponía en crisis muchas veces a esas familias. No sé si haya algo más que agregar. Es importante considerar que seguimos unidos, seguimos en la lucha y seguimos adelante.
I love that. Thank you so much. Along those lines, now thinking going towards the future of Health for All, what would you like to see from the state to ensure that our community can actually access this care now that we've expanded by 2024?
¿Verdad?
I think that was for Enriqueta.
Sí.
Así que le puedo traducir.
Y que de repente se cortó la comunicación. Sí.
Solamente
que de repente se para la imagen.
Okay.
Okay.
It sounds like there might be some internet connection troubles with the interpreter as well. So we'll come back if that's okay. Moving on to JC. Question for you, especially in your role as DHCS. Given everything that we've been able to accomplish, what do you think the future holds for the Health for All campaign, especially as we're gearing up for the implementation of the expansion?
Sure. So first, I would say thank you very much for inviting me to be here. Someone who fundamentally believes that having access to healthcare is a human right, which you just clearly heard articulated by many of the people before me speaking. I can say that DHCS is fully committed to Health for All, and we're very excited to move forward much of the hard work that all of you have been working on for many, many years. I would say, just so everyone's tracking, to date, Medi-Cal has expanded access to over 531,000 individuals. And as we ramp up for January 1 of 24, where we'd be adding an additional 700,000 individuals, that will be 1.23 million people that will have coverage. I will just flag that is larger than some other people's entire Medicaid programs. In fact, most other states' entire Medicaid programs. So kudos to everyone. I would also say that this work has been making a nationwide impact, just so everyone's tracking. Us in California, I actually meet with other Medicaid directors across the nation who are saying, what are you doing in California? Can we talk to you? How are you doing that? How are you drawing down funds for that? We want to do that. So I just want to make sure everybody knows that your work is being taken across the nation and people are paying attention to what California is doing. So really wanted to start with some kudos on that front. So some of the things that DHCS is doing to kind of get ready to gear up. As you may know, in the budget, we did have approval to launch a public media campaign. It's a sizable media campaign. It will be about $25 million campaign. And really, we are going to try to get the word out in regards to educating the public. It will be a multi-prong approach that we are doing. There are multiple pieces that we are focused on. We are focused on getting information out to all the populations that may have an opportunity to join under Medi-Cal. So this would include the upcoming expansion of individuals 26 to 49 without satisfactory immigration status. It would also include the fact that we anticipate the COVID public health emergency to end in next year, and we want to make sure everybody knows what they need to do in order to keep their coverage. Really, really important. We don't want people who have coverage today to miss their renewal and to not have it recontinued. So we really want to get the word out to people to keep their contact information updated with the Department of Healthcare Services. So when it comes time to send out those notices, they can keep their coverage. And we were able to go back and look at our systems to ensure that those individuals that had turned 26 during the public health emergency would not age out. That was an important piece. There was tons of advocacy for it, and we're really happy we were able to find a pathway forward. So there would be no bumpy pieces for them. So we have a strategy in place that complies with federal rules, which we try to do. And we're really happy that will also be communicated to people so that they're understanding that. We'll also be reminding people that the postpartum expansion for 12 months after delivery will be available for all individuals. So including people with unsatisfactory immigration status, we want to make sure people understand their right to that additional benefit for our pregnant individuals. And then reminding people that we have a lot of changes in Medi-Cal, including the asset limits that make you eligible for our program. Some went live in July of this year, and in January 1 of 24, with this other update, we also will be eliminating our asset limits. And so really just making sure everyone's understanding that so they know that they will have access to care and who can be eligible. This campaign will start actually in the fall of 2022, towards the end of this year, and will continue all the way through the spring of 2024. We're just started in this process, but we're really excited. We have a vendor now on board and we are moving. We also are really working with our health enrollment navigators. So we have awarded an additional $60 million that was appropriated through the budget to really get the word out across the state. So we were able to provide awards to 35 entities. That includes 23 county entities, 12 community-based organizations, and that's covering a total of 45 counties in California. So we're really excited that the health navigators will be out there helping assist and encourage individuals in regards to getting the word out around Medi-Cal coverage, how to enroll, and helping them kind of navigate through that process, an important part of what we need out there. We would also say we were really excited that we were able to implement community health workers and promotoras as a Medi-Cal benefit that started July 1st of 2022. It really will help us achieve many of the goals that we have within DHCS. including CalAIM and our Bold Goals initiatives, where we are working to improve quality for everyone in Medi-Cal and really reduce any inequities in our program. And so we were excited when that rolled out. It will include and would allow for community health workers to be employed by hospitals, clinics, provider offices, or community-based organizations. We are working to get our systems updated so the CBOs can go through the provider enrollment process in our system. So we'll be getting information out to individuals because we do know a large number of community health workers are attached through CBOs, not always through various provider offices. So we're working on all pathways. We also released some additional funding, what we call PATH funding, provider funding that would allow people to apply for funds to increase their capacity and infrastructure. We know that there are people that have been doing this out in the community for a long time, but they've probably been relying on philanthropy or other funds to do it in order to increase capacity, which is what we want across the state of California. We have grant funding available. First round just closed, but there will be more rounds in the future. So we really look forward to using those funds to help our providers grow their capacity. And in fact, the largest amount of people who applied for round one were community-based organizations. So we're really happy that we were able to get the word out to CBOs because it's not always a group of individuals that we have direct contact with here at the department. So we're excited the word was able to get out to so many people. I have a feeling it was probably because of many of you on this call today who are spreading that word, but we really, really appreciate it. The other thing we're doing is we want to make sure managed care plans, I'm sure people are tracking, but once everyone moves in to Medi-Cal come January 1 of 24, 99.5% of our beneficiaries in Medi-Cal will be in managed care. So managed care plans are some of our biggest partners. So we are working with our plans right now to have them create a community health worker integration plan, them kind of telling us how are they going to, integrate community health workers and promotores into their way of doing business, into their network, their access, how they're going to ensure that they are using them to get out in the community, to provide that education, to make sure people understand the benefits that they have available to them. And so we're really excited about that new partnership. So those are some of the things the department is doing to really make sure that we are maximizing the opportunity that's been given, to make sure we're getting the word out to as many people as possible. And really, at the end of the day, partnering with trusted community partners to go in and really inform the communities across the state of California to make sure they get access to the services they need, and those who are currently enrolled in Medi-Cal getting enrolled so that they can have access come January of 2024 when we expand to all ages statewide. So thank you for the opportunity.
Thank you, JC, for that wonderful overview of all the excellent, not only Health for All victories, but all the supplemental efforts. I think just as a reminder to the panelists, we do have interpreters, so if we could speak a little bit slower to just make sure. I know it's hard because we all are so excited about Health for All, so just wanted to remind that. And again, thank you, JC. Moving on to Marisol, having the California Endowment powerfully support this campaign from the philosophy, gosh, I need more coffee. From the lands of philanthropy, how did you help get us past the finish line?
Hi, Kay. Good morning, and good morning, everyone that's tuning in. Thank you to LCHC for inviting me to be here today. It's such a pleasure having been part of this campaign for almost a decade. As Cynthia has mentioned, it's an honor to be here to take a moment to celebrate and look back. And so, the California Endowment has been in partnership with many of the organizations here today in support of Health for All. And it has been a marathon, right? And so when you're preparing and running a marathon, there's like not one single thing that will get you to the finish line, right? You train, you build your strength, you hydrate, you fall and get up and keep going. And so it's been it's felt like that's been the journey of Health for All. And as Cynthia has mentioned, centering the experiences of undocumented Californians, has been a space where the endowment I feel has contributed to the campaign really through communications and an inclusive narrative effort across the state through, whether it's branded materials or whether it's been, telling the stories and uplifting the stories of our undocumented Californians. And so seeing that as the center of what we see as a robust ecosystem that, got us to the finish line. So it's them at the center, but it's the advocates, it's the organizers, both at the statewide level as well as at the county level, who were advocating. Also, a county board of supervisors for expanded coverage. It's as I mentioned, the research partners. It's just this entire ecosystem that centers the lived experiences and the voices of undocumented Californians. And but it's also we can't do this in an environment that doesn't lend itself, right? So you can create this ecosystem and echo chamber as well of inclusive narrative, and there's also the realities of the policy and the budget outlook. And so without that, would have been very difficult also to get us to the finish line. And then there's the leadership in the legislature and the administrative level and executive branch, right? That also contributed to getting us there. So, we see it truly as a collective, as an ecosystem approach, and again, with people that are most impacted at the center of that ecosystem.
Thank you again. Just really speaks to the need to have a community focused, but also collaborative push together to achieve more. To think of the final question I want to leave with all of our panelists, thinking of the future for Health for All, what is left to do? What do you see as the future for Health for All? We'll start with Cynthia.
Yes, it's a very, very important question because as I always say, sometimes we think that once a campaign is done and a policy proposal becomes law, that the job is done. Far from it, right? Because implementation is so important. And of course, that would be one of the next biggest things is what do we do to make sure that these expansions or these opportunities to include our immigrant populations actually work? And that means that we need to remove every single barrier that will keep them, that will keep this 1.2 million people, that 700,000 number that JC included here, included, to make sure that they benefit from this very, very important expansion. Undocumented communities have been excluded from the healthcare system for so long that it will take a committed and robust not just community outreach, but really a comprehensive plan for implementation to make sure that whoever is eligible can enroll and get covered. In the very beginning of this campaign, our goals were twofold. One was expand access to state-funded medical for everyone, regardless of immigration status, which is what we're doing now. But the other one is for those who will not be covered, how do they get access to the covered California marketplace? If you remember, for those who are here, who've been here with us for a while, we passed a legislation a few years ago, as I put in the chronology, directing the state to apply for an Section 1332 state innovation waiver, seeking approval to do this. When Trump became president, Senator Lara at the time rescinded that. But that was submitted to the Health and Human Services Department for review. And now we're doing that. We're going to try to do that again, taking a page from what Oregon, Colorado, and Washington State are already doing. And now that we've made history by becoming the most inclusive state in immigrant healthcare, CAPC and health access are researching avenues for a 1332 waiver to grant access to the marketplace for undocumented Californians. So for folks who are in the covered California space, we will be knocking on your doors in the next few months as we beef up the work on this campaign. I can't get into a lot of specifics because we're literally just, debriefing the last legislative session on the Health for All, including the 26 to 49 years old. And so we're still working out a lot of details through our policy teams, but we are closely monitoring what the Health and Human Services response is going to be to the request of our colleagues at Washington State. We're actually attending some of the meetings of our partners in Washington State to see what is going on with their conversation on that, while at the same time thinking through many other factors that are unique to our state that would make sure that our waiver is also different from other states. Again, can't divulge those strategies because they are still incomplete, but as our commitment in the past, so it will be today and in the future, is to make sure that you all are included in these conversations, that your input is important because many of the members of LCHC work directly with impacted communities. So the work is not done, as I said. There is cause for great celebration at the moment for what we have accomplished, but we're also excited to really kind of finish the job, sort of, because we know that there are still populations that will be left out by Health for All. And we want to make sure that they too do not remain uninsured in one way or another.
Thank you, Cynthia, and completely agree that the equity is built in the last mile of implementation and the work is not done yet. I know JC has to leave in a few minutes, so I'm going to ask her the same question next. What do you see as the future for Health for All?
Thank you. For us right now, we're 100% focused on ensuring as many people get enrolled as possible, but really to the sentiments made earlier, we really need to make sure that once people have access or coverage, I would say, that they actually have access to care and access to high quality care. So the department is really working on looking at our provider access across the entire state of California to ensure that people have access to care once they are, receive their Medi-Cal card. It's really, really important to us, and making sure that we're partnering with our managed care plans to really increase the quality and the changes at the delivery system to improve quality of care, including things like getting the community health worker benefit, which has started, but we really need it to expand across the entire state of California. So that is what we are really focused on here at the department. It needs to be more than just access to coverage. It needs to be easy access to services and high quality services for everybody, and making sure that there are people in the community that can connect them with that service, that can speak to them in their language, and that can get them access to those services. And so that is where we are 100% focused on in the future, of making sure that we really bring what was intended with Health for All to all Californians. So that's where we will be doubling down. We know that that's not always popular work. Well, it's popular with most people, but it's hard work is what I would say. And so that's where we will focus. And again, thank you so much for inviting me to be here with you all. If I do sneak off, it's because I'm speaking at another event. And so I want to make sure I'm timely, but it's been a pleasure today.
Thank you, JC, for joining us. I'll pass the same question over to Marisol.
Thank you, Kay. One of the things for us that we're going to be working on in the next few months is, as we're getting information out to the newly eligible population, is going to be, messaging around public charge, which we know is still a big issue in our communities. And, in order to ensure that they feel comfortable enrolling and accessing services, there's still a lot of work that needs to be done to get rid of that chilling effect that public charge has had in our communities. And so that's one space where, as we start getting the word out, we're going to be focusing on along with, just the broader message of enrolling. And, I think also looking at lessons learned, right, in terms of the victories that have taken place in California, and then for the implementation of all of these wins, how do we look back and learn from implementation efforts and carry them forward, into the future, into other spaces. So thanks again for having me.
Thank you again for joining this wonderful panel. Last but certainly not least, Enriqueta, what do you think the future, what is left for us to do? Where do you want the future of Health for All to go?
Bueno, es bien importante, impactante esa pregunta, porque quisiéramos tener muchísimas cosas al mismo tiempo, pero creo que es importante considerar que el impacto que ha ocasionado la implementación de esta nueva etapa en la salud para las personas mayores de 50 años fue grande para los que lo recibimos, pero todavía hay muchísima gente que todavía no está enterada por este programa, y creo que son las comunidades más alejadas de la ciudad que necesitan esa ayuda. Tenemos muchísimas promotoras. La semana pasada estuve en una reunión de promotoras, 500 de ellas participaron, considerando que ellas tuvieran el conocimiento completo para poder participar en la comunidad y acercarse a esas comunidades que están alejadas. Viven en los ranchos, en las afueras de la ciudad, alejados de cualquier contacto, solamente accesible a la comida, que es lo que más les importa, y el trabajo que tienen que realizar. Pero si nosotros multiplicamos nuestra labor de acercamiento a todo este servicio, sería importante y serían mayores los números de las personas que estén registradas en este programa. Creo que es importante considerar los grupos organizativos que han trabajado en la comunidad peleando los derechos humanos, en este caso la salud, vivienda y trabajo, educación, y sobre todo el respeto y la dignidad al ser humano. Para nosotros es importante considerar que cada persona es parte de nuestra comunidad, es un hermano, sin mirar la raza, sin mirar absolutamente ninguna otra característica, porque todos estamos en este país y todos necesitamos de esos servicios. Ellos dicen, pues tú estás dentro del área de educación. No importa, lo demás sí importa, porque todo está relacionado a un ser humano. Y creo que tenemos que tener ese sentimiento de ayuda y de apoyo como lo hemos tenido por la lucha de nuestras realidades. Creo que sí, incluir a todos estos grupos participativos en la comunidad que son el enlace, y la comunidad tiene confianza en ellos. Somos líderes, empezamos como voluntarios, líderes y promotores. Entonces, escalando a ese trabajo que hemos realizado por muchos años, creo que sería importante que estos grupos que ya tienen esta capacitación y que ellos los incluyan para que puedan extender la información y el acercamiento a este servicio tan impactante que hasta la fecha yo sigo agradecida porque soy parte de este programa, este proyecto que se ha venido luchando por muchos años. Y de verdad creo que sí es no solamente la persona que hace los números para presentarlos y decir se necesitan esto, pero darle seguimiento a este proyecto porque nunca va a estar concluido. Sigue las necesidades en la comunidad. Y también creo que es importante considerar los idiomas para acercar a las personas que no hablan inglés y de otras naciones que son hermanos también y que están dentro de nuestra comunidad para que participen dentro de ese beneficio tan grande y que consideren que no es carga pública, que no van a tener preocupación por ese sentido, que es un derecho que cualquier país debe otorgar a su comunidad y a sus ciudadanos para mantener un país saludable. Gracias. Gracias y saludos a todos.
Thank you all so much. I see that our friends from LCHC for the next panel have popped on, so I will transition from there. Thank you again to everyone for joining the panel of the future of health for all of your dedicated, just diligent work, and for bringing this community and coalition together. It's been an honor on behalf of Assemblymember Dr. Joaquin Arambula. This is by far our most impactful piece of legislation, our biggest champion, and just seeing everything that we've been able to do these past few years has just really shown what this community is going to do in the future. With that, I'll hand it over. Thank you all.
Thank you so much, Doctora Kay. Really appreciate you leading that conversation. To Cynthia, Enriqueta, JC, Marisol, thank you so much for all that work that you do. We know that you are working so hard for our community, and we really appreciate that powerful conversation today. I really appreciate what you all focused on, that health is a human right, that we all deserve the right to be healthy, to have a full life, full of dignity, full of joy, and that health. And this is something that we are able to move closer to by providing access to Medi-Cal for our undocumented communities in California. So thank you for leading that powerful work. And to get that shared, that we are all brothers and sisters, regardless of where we come from. And I want us to keep that in mind as we have these conversations today, as we do our work, right? When one of us is healthy, then all of us are able to be healthier by it. So muchísimas gracias to all of you. I am honored to share space with you. Up next, we will transition to a very practical panel, very, very important. Funding for community-based organizations to advance community wellness. As we know, community-based organizations lead powerful work in our communities, many times meeting the gap left behind by systemic disconnects between the community and government entities. Many CBOs are led and staffed by passionate members, many who have personally faced the issues that they advocate for, right? And so our passion, our heart is fully engaged. And many times, as we know, it is also part of the work of a CBO to fundraise, right? And to ensure that we have enough funding to keep the lights on, to make sure that people are getting paid, and to keep going with the work. And you saw many of our partners from philanthropy, right, across our panels today, and we are partners in that work. If we didn't have that sustainability piece in place, then we wouldn't be able to continue this work. So we are all puzzle pieces, right, in this work. And we all play a very important role in ensuring that we are moving closer to justice for all of our communities. All right. Well, moderating this panel is a real expert in CBO funding, Mr. Chris Sanchez. It is such an honor to have you join us. Chris is a member of our Community Advisory Board at LCHC. We pride ourselves in having both a board, but also a Community Advisory Board, and just really centering community in all the work that we do. Chris Sanchez serves on the Western Center on Law and Poverty's Public Benefits and Access to Justice team, focusing on CalFresh and other nutrition issues, including federal advocacy. He also works on consumer issues and government policies that lead to debt and poverty. Previously, Chris worked for CHIRLA, the Coalition for Humane Immigrant Rights, as well as working as a staff member for State Assembly members Sharon Quirk Silva and Patty Lopez. Welcome, Chris. It is an honor to have you, and I'll turn the panel over to you.
Perfect, and thank you for having me. It's a great time, a great moment for all of us to come together on this beautiful Thursday morning. Bienvenida to everybody as we get into this very important conversation. But before we do, of course, we want to make sure we have some housekeeping that we take care of. First, for those that may need language accessibility and interpretation, if you look at the bottom of your screen, you'll notice a globe, because we're holistic people and we think about as global citizens, that you could press that globe, and hit Spanish if you need that service. And then I'll just also remind our panelists for translation to try to make sure you speak a little bit slower so we can have the interpreter catch up at the same time. And then also as we get into the panel, the Q&A portion, you'll be able to ask questions at the end of the panel, and you'll have an opportunity to submit your questions through the chat box and so forth. So let's go ahead and get started with the introductions. But first, kind of just open up this space on what this panel is. Today's conversation is about grassroots and community-based organizations. Some of you will hear the acronym CBO as what that's what they may be referred to sometimes. How community-based organizations play a powerful and essential role in advancing justice across communities of color. This is because community-based organizations are trusted messengers, often made up of people who are directly from those communities that they serve. These trusted relationships with communities are invaluable and assets, as they have often are the vehicles of engaging communities and empowering campaigns and programs to improve them, to improve the health and livelihoods of them. However, questions about sustainability of these community hubs, there's also questions about what is equitable, and questions about financing these community-based organizations. And that's what we're going to address here today. Today, joining me on this panel, we have an amazing, powerful panel who come from different parts of how we figure out the pieces to this puzzle. And I'd like to introduce them. Rob Liu, Executive Director of the Asian Pacific Partners for Empowerment, Advocacy, and Leadership, also known as APPEAL. Irene de Barbacoa, I apologize, Irene, and please correct me afterwards. Director of Operations and Communications of Leaders de Campesinas. Marcela Rodriguez from the Office of the Governor of California, and Jared Barrios, Senior Vice President of the California Community Foundation. Welcome, everyone, and thank you for being here. We would like to first ask the first question to Rod. Before we talk about some of the financing mechanisms for community-based organizations, I'd like to talk about sustainability for the community-based organizations that are deep in the community and see some of the real need on the ground. What does sustainability mean? Can you describe landscape on what CBOs, how CBOs I apologize, how CBOs and what are complementary services and advocacy, and how do we get this work done with that?
Well, thank you very much, Chris, and thank you to LCHC and Mara and Jeffrey for inviting me to be part of this. It's truly an honor. Just to give a little bit of background of my experience, I've been working in CBOs, community-based organizations, for over 30 years. Particularly in the Asian American and Native Hawaiian Pacific Islander communities. But we have also done a series of community leadership programs across racial populations, including LGBTQ+, plus being able to engage in some racial equity collaboratives, which I'll talk about briefly. I think this is a huge issue, excuse me, around sustainability. Particularly this time in an environment where we are kind of fighting to survive. There's an anti-immigrant environment out there. There are actually a lot of challenges in getting staffed up for some community-based organizations because of the environment of other opportunities, and also really needing additional resources to do some of the work that we need to do specifically around advocacy, which I will also talk about. I think it really comes down to what I would describe as equity in funding systems. And I know there will be more discussions later about what funding mechanisms need to be like and what needs to change. But I think that's really critical for sustainability, because I think we really need to think about funding not as a short-term minimal year opportunity, but really as how do we ensure for long-term sustainable funding? And in fact, some funding may actually not be of benefit to community if it's too short-term, because there's no way to continue that. And you start to prep the community for working together. And if you pull that funding, then I think it actually almost can do more damage than good in terms of what we're really looking for. My experience and our experience organization has been around a lot of tobacco control funding. So a lot of the examples I'll probably provide from that. But I think the piece that I really want to emphasize is just creative, innovative funding opportunities that really looks at what communities need, both in the short term and the long term. And one of the long-term pieces that's really, I think, important for us is recognizing the next generation of leaders. So a lot of what we've been doing around community leadership development has been to uplift communities of color by investing in individuals who will be the leaders of community-based organizations in the future. That's something that we started maybe 15 years ago. And we've worked in states like Washington, Texas, Oklahoma, California, and probably most significantly Minnesota, where we were responsible for coordinating the LAMP Leadership Institute, which is an institute that provides community leadership training for 30 fellows from 5 different party populations, including the 4 racial ethnic groups plus LGBTQ plus. And the piece around this that I think is really important is twofold. One is to not underestimate the power of communities. We invested over a year in these leadership programs. We worked with cohorts of fellows who represented a variety of different sectors, many of them being CBOs, but they worked together to create policy change projects. And again, this was on tobacco. But for example, the African-American group decided that they wanted to make foster care smoke-free. So that in a very short amount of time, they invested their efforts and probably over 2 or 3 months, met with the commissioners in Ramsey County, which is in the urban area of Minnesota, particularly Minneapolis and St. Paul, and were able to convince them to pass a policy. And what happened next is the power of communities. And that was other communities or other jurisdictions saw that this happened and decided that they wanted to make smoke-free foster care a reality as well. And pretty soon statewide, smoke-free foster care became the issue and the policy. And what that told me is that if you invest in communities and in community-based organizations, not only do we have the power to be able to solve problems in our own communities, but we have the power to contribute significantly to the health of all in that area. And I think we sometimes think funding-wise, the impact is going to be small when the potential is tremendous. So really wanting to kind of uplift the importance of investing in capacity building, community leadership, but also the power of communities. The second piece that I think is really important is our efforts around cross-racial equity collaborations. And I know that we could talk a lot about different aspects of sustainability, but a piece, because I think it's a timely issue with what's been happening with the LA City Council and other entities, that it's important for us to find ways to incorporate within funding and sustainable funding opportunities for communities to work across and not only just serve their own communities, but be able to support other communities. And it's interesting in Minnesota, when we started exploring this idea of this leadership program, we got a lot of, as an Asian organization, a lot of doubt and that we could actually pull this off. Some doubt that I would almost say may not have been the same if a white mainstream organization had gone in. And part of that has to do with systemically in many of our communities intentionally or unintentionally are raised to kind of think that they're competing against other communities of color. And some of it's very real, but I think part of it is a little bit about the frame for how things happen. So this leadership program really challenged that idea of being able to work across communities. And interestingly, many of the fellows in our program were newer, younger staff, not necessarily the directors that were kind of ingrained in their beliefs, and not saying that there weren't established leaders that had the ability to work across communities, but there perhaps were things that were harder for them to do in that mechanism. So when working with younger folks, they were almost have an open slate in terms of how you work. And I think we have to build in within funding mechanisms and the idea that working across communities is a big part of that work as much as it is working within our own respective communities. There was a fellow who actually was from the Latino community who said at the end of his experience that not only did he have the ability to learn more about other priority populations or other communities, but he also learned about how much he didn't know about his own community and the diversity within that. So I think there's a lot of potential for that. The final thing I want to share before passing it on is really the idea of supporting some of the things that are not supported usually. Sometimes funding is inflexible, sometimes it's very specific, whether it's because of a legislative mandate that you have to do, for example, tobacco control work only. But I think we really need the opportunity for flexible funding because our communities are impacted in many different ways. There isn't just a single issue that we deal with. The need to kind of uplift the advocacy work that needs to be done. So again, some funders aren't able to support that, but we need that to be able to carry out the voice of our communities, to build the pipeline and capacity of our communities, and really to address kind of core root causes of inequities in our communities. And so there's an effort that we've been working with LCHC on, which is the Health Equity Racial Justice Fund, which would provide funding to community-based organizations directly to address social determinants of health, root causes of many of the issues that we see featured in our communities. This has gotten support, wide support. We still haven't kind of reached to the end. We're still kind of working on that. But ideas like this are really important to have dedicated funding, specifically look at root causes and sustainability of our communities and what the future of our communities will look like, including the young leadership that is going to be involved in that. So let me stop there and just pass it off to the next person.
Perfect. And yeah, I just really want to kind of expand on something you really mentioned, and which kind of leads into our next piece to this. But flexible funding is critical, especially at times when our community needs healing or needs a response. If we look at what's happening in Los Angeles right now, if we look what happened during the George Floyd murder and the community cry for healing and reform, a lot of that advocacy that went into that work, I'm sure a lot of organizations didn't have any grants that were written for it or anything like that. So flexible funding for organizations is really critical, because at the end of the day, they still have their deliverables while serving the community in that time of need at that moment. Well, it brings me to my next panelist, Irene. When it comes to government funding, it's a little bit different. And we want to kind of dive into that a little bit more and ask you, based on your experiences, what are some of the benefits and how does it advance your work when it comes to getting funding from the government? And what is it like working with government when it comes to grants? Are there some challenges? And maybe talking about some of the processes that go into securing a grant, and how do they differ from the foundations that you work with as well?
Great. Thank you, Chris. And nice to be here with all of you. Definitely, we've had some struggles, right, along the way, especially here during the last 2 years during the pandemic. So I work with Líderes Campesinas, which is a farm worker serving organization. And in many ways, government grants obviously are a bit more restrictive, right, as opposed to foundations and private funds that we've received. And a lot of times, well, those make our work a lot harder in terms of administrative issues, requirements that we need to address. But some ways that government grants definitely elevate our work is it's aligned with our mission to be able to be at the table with state agencies, with representatives, and work towards systems change collectively, right? That's definitely the ultimate goal, and we feel very content with some of the work we've been able to do, especially in the last 2 years. As I said, a farm worker serving organization where farm workers are deemed essential during a pandemic. The voices of farm workers is essential in order to address the needs, the inequities that exist and have existed way prior to the pandemic, right? So as being at the table with different agencies like the EPA, pesticide management groups where our executive director is a part of, we're there and we're able to provide feedback, technical assistance, bring in the farm worker voice in these areas where they often are not heard, right? So being able to create a roadmap with the EPA for better using and finding alternatives to harmful pesticides. Also, being a part of more government grants has allowed us also to be invited at the table with CalOSHA, being a part of advisory committees to improve the standards with COVID-19 protections. And so there's other examples, right? And not only were we invited, but we were a part of advocating for these task forces to be implemented. So I look at that as one of the main benefits of working on government grants. However, the restrictions, the administrative burden has been hard in terms of being able to focus on our work and our capacity, as opposed to with foundations. Unrestricted grants helps us do the work in a fashion that we feel is more productive, or we can sort of complement our work. We can look long term. And so also some of the requirements like insurances, right? That's one of the major things I think with government grants, or being on a reimbursement basis. Sometimes that could be an economic or administrative burden on community-based organizations like ours. Having to wear several hats at times is something that with government grants, it doesn't cover costs like HR and different things that will help us in the long term and build our capacity. So they're very program specific, project specific when it comes to government grants. So unrestricted funds from foundations and private family funders, let's say, have been sort of this gift to supplement the government grants, allowing us to perhaps take burritos to the fields to help us do interactive outreach with rural communities, to farm workers. Things that really people truly appreciate, right? And it helps get our message across, like you mentioned, the trusted messengers. That's definitely something that we're very focused on, is being the trusted messengers, bringing the resources to the communities that don't often have access to many resources, whether it's due to language, technical skills, internet access, various things. So being able to have funds to complement our work while we go out there, bring them some gifts or whatever it may be, right? To appreciate them more and make them feel as essential as they are. That's where unrestricted funds have really helped organizations get the work done in the manner that we feel is effective, right? And so I think in terms of the major challenges with government grants is just those insurance requirements and administrative issues that we have to sort of all come together and figure out how to work around them, right?
Perfect. And thank you for that. And yeah, I mean, sometimes I think when the legislature is approving some of these grants that go out, they might not be thinking about that other piece on how do we really support the organizations that we want to do the work, and what does that look like? But also, you know, can the state agency that you're working with or the department have a little bit more flexibility And that's important to ensure that we're sustaining the organizations, truly sustaining them. Which brings me to my next panelist, Marisela, talking, from the government perspective, of course, from the governor's office, and thinking about, what value is it, that does it have to partner with the community-based organizations in some of this work, and to the state, what value do community-based organizations have? Do they add to the state in doing this work when the government might not have capacity to do so, or not be the right messenger?
Great, thank you so much. And I want to start by saying that, I've become a pet owner recently, and so you might hear 2 puppies in the background. So I apologize for the background noise. Excited about the puppies, not so much the interruptions, but thank you so much for having me here today. I just want to start with a huge appreciation for inviting me, but second, offering this platform, but most of all for the work that the state has been able to do with so many of these organizations that are here today, many who are not here today, but just I think, for some of you who may not be familiar with, with my role, part of what I do for the governor's office is work on the highest priority public education and community outreach campaigns. And that includes, census and COVID, as well as some other campaigns that I'm happy to talk about if it's of interest. But I just, with those 2 alone, I wanted to raise those 2 as examples of how critical the role of community partners has been, and the huge partnership that was established through census that was coordinated both at the local and the statewide level, that we were able to then shift and implement as part of our COVID response, that included, making sure people knew how they could stay safer, understood sort of the latest guidance. And, once vaccines came into the picture, the importance of getting vaccinated and boosted and tackling the misinformation that continues to this day. And so the role of CBOs for this critical work was, helping us reach communities at a time that was super critical, super important, communities that are often very hard to reach, communities that often experience the greatest social, health, and economic disparities and inequities. And so we could not have done this work without the partnership with so many CBOs, and the partnership that we also had with philanthropy that allowed us to really strategize together and make our dollars stretch and really be coordinated and share information. So, just wanted to start with that huge appreciation, and in some ways start to answer the question about the value of CBOs. Again, we could not have done this work, and we've learned along the way. By no means do we think it's, a perfect model. It's evolved over time because of the input that we've gotten by CBOs about what's working, what's not working in terms of how we work with them, but also, what's happening on the ground and how state government is responding, whether it's from an operational standpoint, an information standpoint, and creating that information loop that allows us to take that back to state government and help us make adjustments to how we are responding and engaging with communities. So just like, I could go on more around the value of CBOs just alone with those 2 campaigns. And so, to kind of lead into another part of your question is just because we saw this model in working with CBOs and how we were really able to reach communities in critical parts of the state, it allowed us to make a case to say this work is important and it needs a home. And so in the last state budget, we were able to establish a new office, the Office of Community Partnerships and Strategic Communications. And a bulk of the resources there is really to support local assistance. And we have funding through fiscal year 2025, 2026. At that point, we'll have to go back and make an additional funding request. But it was very important for us to have multi-year funding so that we could think about how we could do a little bit more longer term planning, because again, when we have these this approach where it's, you know, it's temporary or it's unpredictable in terms of, you know, when it will end. It's challenging for both the CBOs as well as the state in terms of how do we plan. And so on the CBO side, you know, how do they plan in terms of hiring and everything else they have to take into consideration? So that multi-year funding is something that we're excited about and want to think about how it also not just, you know, helps us with our planning and execution, but how that helps with the CBOs that we're going to be working with. So I think there might be other questions you have for me, so I'll pause there. Or I can keep going, but let me know. But I just wanted to share a little bit about our appreciation and outcome that really kind of stems from how valuable our partnership with CBOs has been.
No, and that was great insight. And I do want to, you know, kind of ask you a question, since we do have an opportunity of having you here. You know, in conversations when we're thinking about you know, policy change and maybe introducing a proposal in the legislature or, you know, so forth, there's always one of the questions that most folks get is, oh, well, how much is philanthropy going to put in, and how much is the government going to put in? And I think, you know, having the question about what does that look like, and what would be some of the recommendations that you would provide to folks that are looking to introduce a proposal that would create a grant, or you know, what kind of message do you want to provide to philanthropy about what kind of partnership that we should see from them when it comes to partnering with government as well?
Okay, and let me know if I don't answer your question. And, you know, I want to take the opportunity, since you asked about philanthropy, to also mention that we do have a senior advisor for social innovation. And I'm happy to put her contact in the chat after I'm done talking. But you know, her role has been so critical, you know, and new to this administration. You know, it's one of the priorities for this administration was to have this role and help us, you know, really expand innovative partnerships with not just with CBOs, but as we think about other partnerships too. And so I definitely would want to make sure that as we're thinking about the coordination and the partnership with philanthropy, that, you know, we're engaging her as well. And so I think that, you know, if there is an idea and it's related to any particular like issue area, I also would encourage connecting with the respective like agency or department. And I'll take an opportunity also just to mention too something that you may be familiar with, but recently, you know, the governor signed an executive order that, you know, with the intention, with the goal, with the mission and the vision to really embed equity into, you know, all parts of state government, policies, budget, et cetera, and into how we do business really. And so part of that includes how, you know, asking our agencies to update their strategic plans, that they be informed by community, including the engagement with CBOs. And so I want to connect the dots there because I know the topic of like, how do we get to root causes of some of these disparities? How do we engage when we have ideas? All of these things, you know, I would just encourage engaging directly with the agencies and the departments that touch on these issue areas, connecting with our social innovations officer, social innovation senior advisor, just because we want to have that coordinated effort across state government. And we all play, you know, different roles. And, you know, our hope is that we are coordinated as we move forward in addressing concerns and questions and opportunities, and that we're always thinking about how we can innovate. But let me know if that didn't answer your question. I want to make sure I answer it.
I think for the most part, I'll just, you know, briefly say, you know, during the census conversations, for example, a lot of what we heard was, you know, the government wants to fund, you know, X, Y, and Z, but what are we hearing from philanthropy? And that's just one example of what we hear often in all policy conversations about how does philanthropy partnering with government in funding. And so I guess it'd be just more of a question of, what kind of advice or suggestion would you say that our other perspective as it relates to that partnership that government seeks or needs from philanthropy?
Yeah, and I honestly, feel and recognize that, it's with this role of our social innovations senior advisor, the goal has been to do more coordination and really kind of strategy with philanthropy, because as we've engaged, when we work with philanthropy with census, we had the intention of not just necessarily saying like, how do we fill the gaps? That was a really important part of the conversation. Like, how do we have a different approach to this work, and how can we be partners to strategize together, share information together, and then help our dollars stretch? And so I think that the role of the social innovations senior advisor is really important, because I think that sometimes you have to have those conversations together and at the start, so that we both know what the state is doing as well as what philanthropy is doing, and bringing folks together, I think, helps answer some of those questions. So I apologize if I'm not answering your question, but I think for us, like, we're trying to be more intentional about partnering with philanthropy early on, so that we can communicate, here's what the state is doing, here's the conversation we're having with philanthropy, so folks generally know here's what we're doing together, so that it's not disconnected, and folks don't feel like they don't know if they should go to philanthropy or they should go to the state. And instead, how do we have a coordinated strategy with philanthropy, and what our different capacities are, what our approaches are. So if folks have different questions or suggestions about how we can continue to improve upon that work, definitely open to those conversations, because it's really important for us to make sure that there's clarity, and that there's we can answer as many questions as we can.
Perfect. And I think, one takeaway for everybody is absolutely, doing the work early if you're going to create a policy proposal, but having those conversations continuously to make sure that there's partnership, which brings us to our next panelist, Jarrett, and who comes from philanthropy, the folks on the funder side, and talking about advancing the goals of, how can philanthropy advance the goals of engaging community-based organizations as hubs to promote equity? Are there any lessons learned that you can offer our government partners in working with CBOs?
Yeah, well, thanks. And first of all, Chris, thank you for welcoming me. And it's an honor to be out here on this panel. And Maricela, I feel like I've been on Zooms with you before, and it's nice to actually see you on a panel like this where I get to hear you speak. I'm actually going to mention some of our work with you, Maricela, because a couple of the partnerships that I wanted to highlight, I think, answer, Chris, your question a little bit. First, I want to clarify that there are some different things. I don't want to leave the impression, Chris, that the only way that philanthropy is partnering with government is sort of like, oh, how many million are you going to put in, and how many million are we going to put in? Because that does describe certain relationships. It's not the entirety of it, which is maybe a good place for me to kind of launch in. A way that we at CCF, and I should back up and say the CCF is the California Community Foundation. Notwithstanding that name, we are the Community Foundation for Los Angeles County. And like other community foundations, and unlike private foundations, it's probably important for folks to understand CCF as a community foundation, and every county in the state has their own community foundation, has the ability, and some would say, we would argue, the obligation to go beyond just grant making and partner, particularly with government, in some cases in partnership, and in some cases because because community foundations can actually do C4 work, can advocate. Sometimes we're advocating to government in sort of aligned with the community-based organizations that we are funding. So it's a bit of a complex triad, right? And our relationship to government can vary. One example of that right now is CCF is co-leading an effort. My colleague, he oversees our civic engagement team, which is part of what I do at CCF. and Maricela, you know Efrain Escobedo. Efrain has been leading an effort on county contracting with CBO partners. And the goal there is the sort of the everyday procurement work, which can create opportunities for some of our service delivery nonprofits, and some of the more mission-oriented or sort of mission-aligned programs that are specific to certain sectors that go through the contracting profits of the county and can sometimes feel like a root canal for CBOs. We are working, again, in alignment with our groups, our CBOs, to simplify that process. So that's one example of, I think, where philanthropy can, in alignment with, and frankly, you know, led by our CBOs, because it's their experiences which help shape the agenda. But we can sometimes, because of the bully pulpit we have, we can get the attention and engagement of the county, because they often come to us for money too, right? So we can leverage that to kind of create an audience for and an interest in this particular issue around making it simpler. So one example, I think, would be that, sort of advocating for that change. Another would be through kind of wearing, sort of taking on the role of that, almost the government-like role of distributing government dollars. And a couple of examples I would give. Sometimes it's being a straight-up third-party administrator of government funds. Sometimes, and this is the work we've done with Maricela on both the census and in COVID. You know, COVID sort of morphed, right? Originally, we were doing education and preparedness, and then we kind of morphed into vaccination promotion. But those were efforts where we were passing through government dollars to community. And because we're not government, and maybe because we have a different relationship to CBOs, we have the ability, if you know, sort of, what is it, the mission, if you choose to accept it, right? Like if we take on this responsibility, we have the ability sometimes to ensure that our CBOs who we fund in other settings are actually, it is in their best interest to take government dollars, because sometimes the requirements are too burdensome and you're not going to be able to get around, right? The single audit requirement for federal dollars, that just is what it is. But understanding that before you take the dollars, assessing whether you want to take that on as a CBO is something we as a partner can and really should do in that role, right? Of not just because we're the go-between, but because we have a relationship that goes beyond being a third-party administrator. We have a relationship with our grantees that that kind of makes us, it really obliges us to ensure that. So that third-party administrator role is, I think, another way. And then the flip side of that is when we take those dollars, and I'll use an example, Chris, right now, and Irene, this is getting to your point. You talked about how troubling reimbursements, how challenging reimbursements can be. We are about to enter a third-party administrator role with our Department of Public Health with some ARPA dollars, some American Recovery Plan Act dollars. And the key negotiation we have had as part of our third-party administrator agreement has been right around these reimbursements, Irene. So what we have been able to negotiate, I think it originally started it was like you could reimburse up to 10%. So you would have to come back, I think, 10 times over the course of the grant with all the receipts and everything. We've been able to get that, I think, up to 35%.
And briefly, real quick, Jared, if for translation purposes, if we can slow it down a little bit.
Oh my God, I'm so sorry. I am Cuban, and that is my problem, the cross I bear in life. I apologize. Irene was speaking about this as a CBO, right? Reducing the number of times you have to come back and just the whole administrative process, right? You have to submit the receipts have to get reviewed, they have to get accepted before the dollars can issue. By reducing that number, we have the ability, when we're negotiating to be the third-party administrator with the county agency, in a way that the CBOs don't, right? They don't have the ability. They either can take it or leave it. And so what we're trying to do as part of this third-party administrator role is negotiate with our CBOs in mind to make it as least burdensome as possible. That doesn't mean you're going to eliminate all of the burdens, right? It's at the end of the day, like I said, the single audit is the single audit, and we are going to need to make sure everything is at the end of the day, before we can close the books on it, that it's justified, right? And that we can stand up to an auditor and prove that these expenses were actually spent on what the CBOs are all saying it was spent on. But how that goes forward, we can make it easier. So the bidding process, the reimbursement process, these are all areas, Chris, that we focused on. A couple of other quick short ones too, because we've big believer in place-based initiatives and these hubs, right? Of sort of some of the re-granting that CBO leads can do in certain parts of the county. They've been very powerful. I think, Maricela, you're familiar perhaps with some of the ways we've done this with our COVID grant making, but for others to understand, we've sort of created a model where we have 6 regions of the county, and we have COVID recovery leads in each of the county that we are doing grant making to, and they're re-granting a portion of that, doing those dollars to CBOs in the ecosystem. So our CBO partners are joining us in philanthropy in sort of a trust-based philanthropy model to do that. And that builds trust, it builds relationships, it also builds empathy, I think, for government, for those CBOs that are now in the position of kind of having to execute on moving those dollars out. So that's an interesting model that we are looking at. We're learning a lot from that. But it's very much aligned with this movement in some parts of philanthropy towards trusting our grantees to actually help make the decisions for how dollars should flow into community. And then the last quick note I'll make is, I think it's really important. Nobody's mentioned this yet, but data, and specifically using a lot of the data that's out there to help us map where need for a specific issue is, where it exists, so that we don't just sort of, spray and pray, right? Throw all the money out there and hope it gets to the group that maybe is geographically situated best to make the impact. But really, like the social vulnerability index, the healthy places index, there's a lot of data sets, right, that tell us with additional data where a particular area might be to focus on. And this is actually how we did a lot of our COVID work, Chris. We, in partnership with the county wasn't, but we were able to get them to embrace the idea of actually do geospatial kind of mapping of this data and target down to the census tract level the communities that we knew were the most impacted by COVID. And therefore, we wanted to target CBOs that were serving those communities as opposed to doing it wide. And through an equity lens, right? Like that should speak to all of us who care about that, because these are the communities that were really impacted in various ways, most dramatically. And the important lesson there is we knew they would be, before COVID ever hit, we could have predicted those would have been the communities because the data actually tells us. And so as philanthropy, helping to kind of pay for that research and steer government partners, but also fund nonprofits who the data were telling us, like, these are the ones that we should be supporting because they're actually in this particular part of Southeast LA, right? Or whatever the geography is, has really helped. And I think we've been able to play a role in helping support our government partners better understand that, that targeting part of where the dollar should go.
And, that brings up actually a really great point. When you target very specific CBOs who have that niche community that they're the trusted messenger in, and some of those CBOs might be smaller than and not have the capacity or necessarily the resources to take in funding from a government entity, but may be able to take it in from philanthropy. And one that comes to mind right now that is really at the forefront of some of the issues we're seeing today in Los Angeles is Cielo. They are the folks in the works with the indigenous community, the Oaxacan community in LA, and there's no one else that's more of a trusted messenger than them. So that's
maybe we could even explain who they are for folks that don't know. So Cielo delivers in-language health education and other supports to Mixtec, 5 or 6 different Mexican and Central American indigenous languages, right? And they reach parts of community that nobody else does, right? Because of their fluency in doing that. And they've been actually trusted partners of ours in a recent Medi-Cal enrollment campaign that we did. And Maricela, they might even be part of our COVID work. I don't have that list in front of me, but they might be one of those supporters as well.
But before we close out this this panel and this discussion, I want to propose a question to all the panelists, and just ask the question: what policy ideas would help CBOs have the sustainability support? And we'll go ahead and start with Rod.
Yeah, thank you, Chris. And I want to kind of build off something that Marcela, you said around valuing of communities, because I really appreciated the way that you framed it. I think that really is the core for why we're talking about CBOs. And I think the piece that's important too is that, you know, marginalized communities are marginalized for many reasons, and systemically, it's much harder to access. And so we even used to describe the idea of hard to reach communities differently and talk about hardly reached. And that's again where CBOs come in, who have the trust, and everybody on this panel has talked about the importance of trusting relationships that CBOs provide. But I think when it comes down to it, and I'll get to the policy piece shortly, is the idea of community ownership. I think if we can reflect on the role of CBOs, and if there is community ownership in all of the efforts that are taking place in health and public health, and that includes policy change. I already mentioned the idea of the Health Equity Racial Justice Fund, which has many of the components that I'm talking about, but the idea of a process that is community owned as well, so that we are actually working to create what we want to see in an actual policy. I would also say that we consider policy not just legislative policy, but also administrative policy. And funding often ties into the challenges of administrative policy, which may make funding to get to community-based organizations much more difficult. I love the ideas that Jared, you mentioned about third-party administrator, because sometimes that is the answer to help to kind of get there. But community ownership that will allow the changing and discussion of how to change these funding mechanisms to make it easier for our CBOs, including small CBOs, to get resources is really critical. And so maybe what we need are community advisory boards, or maybe even community oversight committees in these local and state entities that are great funding sources, so that we can make sure that the mechanisms actually are community friendly and that it leads to community ownership.
So I think if I could jump in here, also something that I definitely forgot to mention also in terms of the difference between private funds, right, as opposed to government, is the reporting, right? That's a huge issue, and the reporting requirements. So I just wanted to kind of get that out there, that at times, especially when you're responding to a pandemic or emergency, reporting can definitely put a big toll on community-based organizations. So that's been really nice to work with private funds that maybe just want to hear reporting in a different way, maybe visuals or more of a dialogue, right? And we feel that sometimes is a lot more effective as well when they really get to know your work. And so reporting, I just wanted to kind of mention that. And in terms of policy, it's something I definitely would need to think more of, but I know we all have talked a lot, like today, about trusted messengers. However, they're even at a national level, right? We see so much funding and embracing the idea of trusted messengers, but we often forget or fail to mention the lack of ability to work in this country. Many trusted messengers are indeed undocumented, right? So we can't forget that. And that's a huge barrier as well, not only on community members, but on CBOs that are the ones working with them, maybe compensating them. And so any policy related to, even if they are able to work legally, but some maybe are fearful of losing benefits that they, deserve, like housing assistance, any other social programs, that during a pandemic, some extra funds for responding to a pandemic shouldn't impact or affect that. So any policy related to that, I think, would be really neat. I don't know how possible that is, but it's something that as a community-based organization has caused some issues at times, is just not wanting to take that away from people that still need certain benefits, right? But yeah, I just wanted to add that, and thank you.
I was just going to add, and I know we're at time, but I just want to say again how much I've appreciated this conversation. And for me, you know, working in the governor's office and state government, you know, this conversation is helpful. And I would just encourage folks to share what some of the best practices you've seen within state government. I know, you know, we've talked about a lot of different things, different barriers that folks experience, and there are some really good examples within state government where there is advanced pay, where there is technical assistance, where technical assistance goes beyond, you know, just assistance with invoicing and application assistance and things like that. So whether it's through our Strategic Growth Council or CDSS, there's good examples across state government. And so if there are best practices, good examples that you're aware of that we should really be thinking about and looking to share more broadly with our state folks, please, you know, please let me know. It'd be great to kind of hear what you feel is working and what some of the best practices are that actually help in strengthening the partnerships with community partners. And Jarrett, really appreciate the mention around a data-driven approach. It's one of the priorities that we have for the new office and for the work that we've been doing for COVID and many other things, where we have a data-driven and equity-centered approach, whether it's been the vaccine equity metric, the hard to count index. Like there's a lot of work that we've been doing to really ensure that we know where we need to invest time and resources, who the best partners are to engage, what languages they speak. Like there's a lot that we gain when we have a data-driven approach and an equity lens to the work. So again, just appreciate the opportunity for this conversation and welcome your ongoing input around what some of the best practices are.
Yeah, I would just jump in and say the same. If you all have, we are trying to get better at this as our own community foundation begins to lean more into the third-party administrator space, kind of as we see it on behalf of and in support of our CBOs here locally. Thoughts that you guys have about what would make it easier to take the dollars or to administer the dollars once you've decided to take them. Those are really, really helpful for us as we go into our conversations. So thanks. Thanks, Chris.
And I want to thank everyone in the panel. I know I promised all the attendees that we would have a Q&A portion, but unfortunately we're at time. But I want to thank the panelists for this conversation. It was really critical, really thinking about how we approach this work and what funding looks like for us. I also want to just hand it over to the folks at LCHC to give you some next steps on what we're going to do for the rest of the day.
Bye, everybody.
Bye. Thank you so much. Thank you, Chris, Rod, Irene, Maricela, and Jarrett. It is really these strategic conversations and partnerships that will continue to move the powerful conversations that we've been talking about and the work that all of our community-based organizations are leading. So thank you for having that conversation with us. And Jarrett, I really appreciated what you shared around trust and empathy. We do this work in partnership, and the search for justice, as we all know, is not an easy one. It's really that work hand in hand, right? Mano a mano, that we're able to utilize to build this community transformation that will eventually lead to healthier lives. And like I shared earlier today, we are all that unique puzzle piece to the greater picture. And we need one another to achieve the change we want to see. So in partnership, in trust, and empathy, we continue to move forward with one another. So thank you for joining us today. All right, well, to wrap up the panel section of our day today, just wanted to bring us back to the theme of today, right? Focusing on community solutions, focusing on the needs of community to advance that systemic change that we all want to see. And, You might have heard many terms flying at you: health equity, health justice, social determinants of health. What do we mean by all of this, right? We envision a world in which each and every one of us, regardless of our skin color, the language we speak, where we were born, where we live, citizenship status, that we can all live full and healthy lives. We deserve that. It is a human right. And we discussed healthcare access during one of our panels, right? That is just one piece of what leads to health, right? And this is where we plug in that term, social determinants of health. And these are other factors that impact our health, such as education, financial support, housing, safety, even the built environment, right? Is there a green park near you, somewhere where you can go walk in the afternoon in a safe manner, right? And really thinking about every interaction that we have around us as human beings as a powerful piece of that ultimate health, both mental and physical. And so thank you all for engaging with us in that conversation. That is the way that we focus our work at LCHC, health and all policies. And that's why you will see us partnering and connecting with all of you and all of our partners in that conversation. For us, workforce development is health, education is health. It is all rooted in the health of our community. And so with that, we will wrap up our panel conversations this afternoon. We will have a presentation where we will be discussing community data, right? To hear what community has highlighted for us this year from across California. Promotoras came together during our listening tour to share those themes with us. And our powerful programs team will be sharing with you all more on that data. And then we will break out into two different groups to talk about policy solutions that we will push forward in order to create that change. All right, but before we get there, we have some very exciting guests with us. One of those is the Chulita Vinyl Club. So we do have a set today for you all from DJ Marvelous with the Chulita Vinyl Club. And they are followed by Luis Lopez Resendiz, who works for Cielo. Thank you so much for joining us. And they will be sharing powerful spoken word poetry with us. So please stay tuned. Go ahead and grab your cafecito, some water, some lunch, and enjoy this break. And then we'll be back soon. Thank you so much.
Murmullo tan suave de mar, traen tus olas recuerdos de amores pasados que no volverán. Tú, que me has visto 1000 veces llorar, ven y dime dónde encontrar un amor que
To some of our sponsors this year. So I'd like to shout out Scan Health Plan. Thank you so much for sponsoring the 2022 Latinx Health Policy Summit for LCHC. Also want to shout out Altamed. Thank you so much, Altamed, for being a Defensor de Salud this year and all the amazing work y'all do. More shout outs to come. Sponsors AARP and San Isidro Health, Kaiser Permanente. Thank you so much for sponsoring the 2022 Latinx Health Policy Summit this year.
Tendrás que pagar todo mi sufrimiento. Llorarás y llorarás.
also want to shout out Packard Foundation and Western Dental. Thank you so much.
Ella era una mujer que a muchos hombres sabía engañar, pero un día vino un hombre que como un beso la traicionó, y ese hombre nunca había querido, y por ese fue que Juana Peña lloró. Y dicen que los años como la nieve fueron pasando, ella seguía llorando por ese amor que nunca llegó. Ay, Juana Peña, ahora me llora y no te quiero yo. Era bonita pero traidora tu Juana Peña, ahora me llora. Ay, Juana Peña, ahora me llora. Juana Peña, ahora me llora. Tiene corazón que falta solución. Juana Peña, ahora me llora. Juana Peña, ahora me llora. Ahora me llora. Ya no te quiero, Juana Peña, ahora me llora.
All right, y'all, let's get ready now. Hope y'all are comfortable and ready for some amazing, important, and critical conversations. Of course, we're all fam here, but we know what we need.
Thank you so much to our wonderful DJ and Director of Policy. That was a wonderful set. Thank you for getting us back in the groove. We're ready to keep moving. We're ready to keep having these wonderful conversations. Up next, we are so excited to have you, Luis, joining us from Cielo. It is such an honor to have you. Thank you for just sharing your powerful work with us. We are so excited to hear your poetry. So, bienvenido.
Hola, hi everyone. Thank you for the invitation and thank you for the space. Greetings from Tonga territory, sur centro de Los Angeles, which is where our offices at Cielo are located. Lately, because of the news of what happened at City Hall, we've been busy mainly in the streets, protesting, demanding justice, the resignation, and also calling for the Latino community in Los Angeles and across the state, as well as across the United States, to reflect on the conversations that these individuals were having in private. Como it made us feel like these type of conversations is the conversations that unfortunately many of the Latino communities have at home, using references to talk about people, indigenous folks, or Black communities in that way. So for us, we're in a time where, as indigenous organization, reflecting on how do we build allyship, if we're doing the right way, creating visibility and maybe people not understanding. So it's that way of building allyship and understanding who is looking for to stand in solidarity with indigenous communities and who is not. Unfortunately, we realize that elected officials in Southern California, among the most powerful politicians, are not. I just want to mention that because it's something that, it's so fresh, and it's using, we're going through a very, very interesting moment here in Los Angeles. I just want to also mention, my name is Luis Lopez Resendiz, didn't say my name. I am the director of the Center for Indigenous Languages and Power here at Cielo, where we provide indigenous interpretation services to many communities across the United States, mainly unaccompanied minors in many detention centers, unaccompanied minors in different judicial districts where they are being detained for not being, once they turn 17, they get transferred to, the adult jails, or a lot of services that we provide, and also making sure that we visualize the different, migrations of indigenous peoples from south of the US-Mexican border to the United States. I wanted to start to talk a little bit about, the work that I write. A lot of the poetry, I see poetry as something that you don't just write about. It's something that the way you see the world, the way you interact with people, those little moments where you create magic, esa conexión con la gente, that time, that connection with people where you connect with somebody in another level, or where you see, that art in the community. When it's like good moments and when it's bad moments. I want to start with, I know there's interpretation en español, de inglés a español. Este poema va a ser en español. This poem is going to be in Spanish. So if you don't speak Spanish, I recommend you to transfer to the English channel, so that you can get this poem in the language you understand. This is a poem that I wrote when I was in San Antonio, Texas. Cielo was called to assist indigenous migrants that were in that trailer where many 52 migrants died. A lot of them were Latinos, but a lot of them were indigenous communities. So I had to be out there and in support of, the communities. And it wasn't easy. It was a hard moment, especially because I had to go with family members into the morgue. And, ese olor a muerte is something that stayed with me. And it's something that now I carry, as a reminder of the work that, it is important to do. This is not something that we enjoy doing, and it's not easy, but it's something that needs to be done. So este poema, I also share this poetry on TikTok. I do short stories on TikTok, so I'll share that with you all later. So, va a estar en español. Ok. ¿A qué huele la muerte? Me pregunto. ¿Cómo es que se siente la muerte en el corazón? Me cuestiono. Yo creo que la muerte se manifiesta por medio del cantar de las chicharras en la noche. El olor conecta la memoria y nunca saldrá de ese espacio entre el presente y el futuro. Ese olor de muerte, ese olor que se siente. En los últimos días he sentido las almas de aquellos que gritaron. Las hermanas y hermanos que se fueron y no se despidieron. Pero yo soy camino y he aprendido a caminar con su compañía. He aprendido a pedir que su partida fluya como el sonido que hace el viento cuando acaricia los ríos, cuando acaricia las flores, cuando acaricia los árboles. He aprendido a caminar y a mirar el mundo diferente. Gracias a las ánimas por las enseñanzas, pero es hora de que deban de caminar en este gran camino donde nos puso el universo y encontrar la luz del otro lado. I'm gonna keep reading some of the other poems, but I remember when I was in San Antonio, estaba el sonido de las chicharras. No sé cómo se llaman las chicharras en inglés, pero las chicharras es este animalito que llora por las noches. Y yo sentía que en ese momento, cuando estábamos allí en San Antonio, cuando estábamos donde murieron los migrantes, las chicharras lloraban más de lo normal o contaban más fuerte de lo normal. Se escuchaban como si la gente misma estuviera gritando, como gritó en ese tráiler mientras muchos morían. Entonces, basado de esas chicharras, tengo un blog que también escribí un artículo sobre la chicharra porque le pedí a mi abuela, que es ahora una estrella en el universo, que me ayudara y que me guiara en estos momentos muy duros, donde estábamos viendo mucho dolor y que me diera un mensaje. Entonces ella en mis sueños se manifestó y me dijo que las chicharras son las mujeres que llegan en la noche a llevarse a las almas perdidas que se quedaron en el desierto, a llevarlas al lugar de donde vienen. Y ellas son las que vienen con sus cantos, llaman a las almas de los perdidos. Es por eso que era importante ponerle atención a lo que estaba pasando, porque las chicharras estaban haciendo el trabajo de llevarse las almas perdidas hacia el eterno descanso. Y este es sobre la frontera. Este es sobre la frontera. ¿Cuántas veces te debemos cruzar para poder vivir en paz? ¿Cuántas veces a cuántas almas te vas a llevar para que nos dejes caminar? ¿Cuánto tenemos que llorar para que te termines de oxidar? A veces que me pregunto si alguien me va a contestar. ¿Cuánto tiempo hasta que podamos regresar libremente a nuestras familias sin tener que llegar en una caja de madera o en un ataúd? O peor aún, regresar en polvo. ¿Hasta cuándo nos vamos a mentir diciendo que la migración es bonita? He pasado mucho tiempo pensando en mi regreso a casa, pero la ansiedad de ese pensamiento domina mi cuerpo porque las personas a las que yo quisiera ver ya se fueron de este mundo. Y aunque con el paso de los años me he vuelto fuerte, mi corazón aún siente la ausencia y las ganas de llorar. Entonces hay un miedo que domina mi pensamiento de regresar a casa. Es por eso que no he regresado. Also, I'm undocumented, so I can't really go, but even though I had the opportunity to go through advanced parole, my mom passed away. So going back, it triggers me. It's a trauma that I don't know if I'll be able to handle, knowing to go back to the place where I was born to not see my mom the way I wanted to see her alive. And this is another one sobre las chicharras y sobre San Antonio. Not las chicharras, sobre San Antonio. And a reminder of the work that I do and why I do it. Even though it's painful, even though, it might have its moments when, we are working in pain, but everything has a meaning and everything has a purpose. And, I'm just doing what I was put to do in this universe, en este camino. Este sí es en inglés. After spending 15 days in Texas, a memory came to remind me of why I do the work I do. I was reminded of the days I worked with my dad under the sun, building the most beautiful and detailed houses of San Diego County. My dad is a construction worker. He took me to work at a very young age. I was 12, and he was teaching me the importance of appreciating what I have. But most importantly, like any other mistake dad, he taught me the meaning of being creative, the magic, the beauty behind it, the beauty of building something out of nothing, and to move around improvising new ways and adapting rapidly to the changing society, following the rhythms of our corazón. Being able to improvise a beautiful moment when there's chaos all around us has kept me alive and has kept me going. And it also has kept me present in el presente, so I don't lose myself. I think it's always important. I was raised by a father that came to this country without speaking Spanish, without speaking English, only Mixteco. And it's the language that we speak at home. And, you know, for him being creative it's important for him being able to improvise something when we are going through pain. It's important. Voy a leer otro más. And este es sobre the times that we're going right now. Estoy buscando un segundo. Ok. Y como recordatorio, en unas semanas va a ser Día de Muertos o Día de Todos Santos. Y creo que es importante recordar y prepararnos a todas y a todos los que vamos a recibir a nuestros seres queridos. Yo me preparo para recibir a mi abuela, para recibir a mi abuelo y para recibir a mi mamá, que cada año hacen ese viaje desde mi clan, desde el lugar donde descansan, para venir a pasar un tiempo con nosotros en este mundo. Qué rápido pasa el tiempo. Ya es octubre y las noches frías anuncian la llegada de las abuelas y los abuelos. Qué rápido pasa el tiempo. Ya son 4 años desde que murió mi mamá. Ya son 4 años desde que mi mamá se convirtió en una estrella en el universo. Ya puedo hablar y pensar sin llorar, como lloré todos los años anteriores. Qué rápido pasa el tiempo. Antes era un niño con mucho miedo y sin camino. Ahora yo soy el camino donde camina el espíritu de ese niño, solo que esta vez sin miedo. Qué rápido pasa el tiempo. Ahora las noches no son para llorar sin cesar. Ahora son para pensar y reflexionar, para escribir. En la ventana de mi cuerpo, en la ventana de mi cuarto, el aroma de una rosa me visita por las noches. El frío viento que se siente me envuelve con el aroma de las rosas para darme el mensaje de amor y de fuerza, para descansar mientras duermo y para poder caminar cuando sale el sol al otro día. Voy a leer otro antes de que se me acabe el tiempo. A mí me gusta colectar las flores, me gusta olerlas, me gusta sentir qué es lo que el aroma de una flor puede provocar en la imaginación de una persona, o qué puede hacer una flor o un aroma, cómo esos aromas nos trasladan a un lugar especial donde olimos ese aroma por primera vez. Y yo he aprendido a recordar o dejarle mensajes a mi abuela detrás de diferentes aromas. Cuando ella estaba conmigo, le gustaba tener muchas flores. Entonces en la ciudad aprovecho cada vez que veo flores que me recuerden a ella para ir a olerla e imaginar de que ella me está dando un mensaje por medio de ese olor. No más que déjeme aquí. Me gusta coleccionar las flores y sus olores. Me agrada ese sentir que provocan las flores en mi memoria. Cada aroma es un recuerdo diferente. Recuerdo que mi abuela me decía que con los perfumes de las plantas es como debemos escribir nuestra historia. Por mucho tiempo no comprendí. Siempre analicé y nunca comprendí. Pero ahora me doy cuenta que en esta ciudad sin silencio, donde es complicado sentarse a escucharse a sí mismo, las palabras de mi abuela las escucho por medio de los olores de ciertas flores y de ciertas plantas que se encuentran en la ciudad. Ahora entiendo que la historia no solo se puede escribir. Nosotros hemos aprendido a guardarla detrás de los olores y ahí pues dejar nuestro mensaje para jamás ser olvidados y regresar cuando la tierra sopla los vientos fríos, which is now, which is in this period of time when, we're starting to feel the cold air, and for us that is a message. La primera noche cuando hace frío es el mensaje de nuestras abuelas y nuestros abuelos diciéndonos que ya están en camino y que ya están en camino del otro mundo hacia nuestras casas. I'm going to read this last one. So, por mucho tiempo dejé de escribir poesía Antes escribía más, pero después de que murió mi mamá hace 4 años, fue como que entré en un momento de depresión, como en un hoyo, porque yo había construido mi futuro en Estados Unidos en torno a la idea de que yo iba a regresar a ese lugar donde nací con mi mamá y a construirle la casa que le había prometido. Pero cuando ella murió, sentí que todo eso que había construido se fue con ella. Entonces dejé de escribir y entré en un momento donde no podía ser creativo. Mucha gente dice que el tiempo lo cura todo, y en ese momento cuando me lo decían yo pensaba que era la cosa más absurda, que el tiempo no cura todo, pero ahora me doy cuenta que sí, el tiempo cura todas las heridas, y que sí, el tiempo y la paciencia nos hacen mejor, nos hacen personas que después maduramos y sanamos las heridas y podemos hablarlas de ellas. Siempre va a doler, pero podemos hablar. Por lo menos ahora puedo hablar de mi mamá sin llorar, ¿verdad? Entonces, este poema, escribí algo sobre la creatividad que me daba o que me nacía ahora después de 4 años de que murió mi mamá. Dejé de escribir poesía hace mucho tiempo. Es el mismo tiempo desde que murió mi madre. No pude ir a verla. No estuve en sus primeros momentos cuando mi mamá inició su camino hacia mi clan. La luz que brillaba en mis ojos se apagó el mismo instante que dejó de latir su corazón. Y con ella enterré en lo más profundo de mi ser las glándulas que estimulan la poesía. Dejé de escribir poesía. Fueron noches largas de mucho dolor. A veces no se sabe cuándo entras en depresión y lo que hacemos es seguir caminando, tratando de creer que todo está bien y que la vida sigue. Hay un momento en este gran camino cuando te encuentras con un espejo frente a ti, y en ese momento, que bien puede ser una eternidad, es cuando logras escuchar el silencio detrás de las emociones y de un corazón que desentierra de lo más profundo del ser los recuerdos para transformar el dolor en una melodía que alimente a otros corazones y a otras glándulas para seguir creando poesía. Y bueno, I'll share some links for my blog with you all. I do short stories on TikTok. I think using those platforms to do short stories is always great because you can put an image to it or videos. But yeah, thank you all for the invitation, por la invitación. And I hope that during those hard times, we take the opportunity to reflect, to feel ourselves, and to think what we are going to do as a community moving on, because there's no space for racism and for more harm to be done to communities when we are working hard to create a more inclusive and more representative society. So thank you so much. Les agradezco mucho a todas y todos and for the invitation. And whenever you're in LA, come visit us. We'll get some tacos.
We'll take you up on that. We all need tacos. No, thank you, Luis. Just from the bottom of my heart, muchísimas gracias. Me desgarraste el corazón y me lo construiste de nuevo con tu poesía. Thank you so much. You know, I think your poetry and just the beautiful thoughts that you shared with us really roots our conversations, because we can talk about policy, we can talk about elected members, etc. But the reality of it is that we are all going through our own personal journeys. We are all grieving somehow. And many times the barriers to joy, right? Like reconnecting with our loved ones in our countries of origin, like being able to just travel freely without the fear of not being able to come back to our now home, right? Many times those barriers are placed by systems, right, that were not created for us or by us. And those are the systems that we are trying to destroy, recreate, reimagine, and put together with community at the center, with us as the architects of those new systems, right? And so it means the world to me to be able to have you here today for all the work that you're doing. We saw and we applaud all the work that you've been doing with the reasoning, ongoings, and just having your voice there, you know, with the speeches that went viral with you, just sharing your words, right? Thank you for doing that. It was so powerful to have your voice there. And I want you to know that you are in familia. We also, yesterday, I know you all were busy yesterday, but we shared that LCHC stands against, condemns these acts, and we asked for the resignation of all 4 members. So now, you know, we await 3 more, or Ron also stepped down. So we await 2 more. And so, you know, we are in with you in this fight, and we will not stand with bigotry and hate from anyone towards our communities, Indigenous communities, Black communities, and anyone, because we are all this powerful body, and we are all interconnected. Like you said, we are all part of this universe. So thank you so much for sharing with us. I will transition us now into our next item on the agenda. So please join me in welcoming our Director of Policy, Mar Velez, who will be introducing our next section. Thank you so much.
Yeah, thank you, Cecilia, and just want to say thank you to Luis as well for those magnificent words. I really also felt, you know, the connection between what he was saying and my own experience, and that longing that a lot of us have for family and places that sometimes we can't physically be in, but we know that we carry it in our hearts. So thank you so much, Luis, for those words. We are now at the breakout portion of our agenda and of our summit. Thank you so much for, you know, being here and, you know, the willingness to share some of your ideas, some of your thoughts on today's conversations that we had. We had the first panel, right, all on the future of health for all, and that was a great conversation, just sort of walking through what we've been able to accomplish and what's next. And then we had the conversation around CBO funding and, you know, what some of the challenges are to getting community-based organizations the resources that they need. You know, how can we be better partners? You know, how can we be better partners both with government, or how they can be better partners with us, and then how, you know, philanthropy can support that as well. And so we're excited to dig deeper into these conversations during our breakout sessions. But before that, we'd like to actually bring in our programs team to illuminate what, you know, those conversations that we're going to have in our breakout sessions with some of the community data that they collected this year. This is so important that we keep in mind, you know, what are some of the things that our communities are dealing with. And so our programs team was able to do a listening tour this year, our annual listening tour, to collect some of that on the ground
Your
data.
device isn't registered.
Sorry.
For help, go to its companion app.
Alexa is listening for sure.
Your device isn't registered. For help, go to its companion app.
So with that, I will let Alexa be quiet and hand it over to Rosa and Pau. Thank you so much.
Thanks, Mad. Hello and welcome back. Good afternoon. I hope everyone had a chill, grounding break. Mad, shout out to you. Bomba Estéreo is a personal fave, and that song specifically I love. So thank you for being LCHC's resident cool kid, I always say, and for always providing us with those fire sets. Luis, it brings my heart so much joy to have you here with us today. I've mentioned this in the previous weeks, and through the deep pain that we've lived through in the last few years, and also lots of moments of happiness over the last 10 years of friendship. You know, it's really an honor to share a space with you again. And, I'm reminded of 2 kids who started off organizing in the area, in the border region, el área de la frontera. And now, we're up and down the state, from San Diego to El Capitolio to Berkeley, and now you on the steps of City Hall in LA doing, really important, critical, transformative work. So thank you so much for joining us. It makes me really proud that we're able to cross paths in this way. Okay, so deep breath. I'm going to take a deep breath, and I invite everyone else to take a deep breath. I can't believe we're in the home stretch of our 3rd annual policy summit. Again, my name is Rosa Flores. I'm the director of programs here at LCHC, and I'll be accompanied by my colega Paula Ilescas, who's our senior programs manager. And for the next few minutes, we will be giving you a high-level overview of our listening tour, as Mar mentioned, titled Nuestras Voces, Nuestra Salud, again, to help frame the conversation we're going to have in the 2 different breakout rooms that you'll be able to be a part of. For those of you that were with us yesterday, we did review this once already. Mil gracias for being with us for the 2nd day, if you've been here for both days. And for those of you that have, are just joining us today, we're really excited to share what we've been up to in the last few months. So as I shared yesterday, and I will share again, and I will continue to share, LCHC does not claim to have the answers to all of the issues that our community is confronting. And in fact, a lot of our speakers throughout our summit have reminded us of the importance of knowledge exchange. So I want to continue to encourage for that to take place in the chat today. We know that the issue of health equity is incredibly nuanced, and so our work is never ending, and there's an infinite number of solutions that we can explore. So as we did yesterday, after this short presentation, we'll make space to put forward some of the solutions that you've been thinking of, ideas that have been percolating for you. So let's get started. Next slide, please. Oh, wait, if we could share our slides. Oh, there we go. It's showing up weird on my screen, so everyone else can see the presentation, right? No? Yes, I see some no's and some yes. Yes. Okay.
Rosa, just FYI, it's just coming on as the slide is like one of the speaker boxes. So it's not like we're sharing the full screen, it looks like.
Okay. Is there a way that we can share the full screen? Because I think if it's just a speaker box, that's how it's showing up for me, and it's really small.
There we go.
All right. Okay, cool. Great. So again, if you've joined us for previous summits, the listening tour might sound familiar to you. The pilot took place back in 2019, which was also the same year as our first policy summit. So it happens virtually. And what it is essentially a series of community focus groups or pláticas that take place with community members and community health workers and promotoras and promotores across the state. Here at LCHC, we really strive to ensure that, our policy priorities and our policy agenda aren't just derived from what we as advocates deem as important, but rather combine what we understand is urgent with what our grassroots leaders especially are experiencing in their communities. And therefore, the purpose of this tour is to better understand the needs and priorities of the Latinx community and utilize that data to inform the comprehensive Latinx Health Policy Agenda. So background on the regions that have been engaged, we have Central Valley, of course, Los Angeles, Orange County, San Diego, and this year, which is a little different from last year, Sacramento. The method of engagement is virtual because of the COVID-19 pandemic. We're still being cautious about the spaces that we meet in person. And so each of the sessions is about 120 minutes each, so that's 2 hours, and we have about 20 CHWPs who engaged in conversation with our staff. By the way, our staff is fully bilingual, so all of the sessions were either English and Spanish, so a mix of bilingual, or simply in Spanish because that's the preferred language of a lot of the CHWPs that we work with. We have briefs that resulted from the listening tour, which we'll review in a bit, and they'll be available to you post-summit and available on our website. So you'll get a full breakdown of demographic information in the briefs, but some of the highlights that we felt were important to illuminate are that 54% of participants who engaged with us this year fall between the ages of 35 and 54. So certainly a lot of the pieces of legislation that we were pushing for this year and things that we're looking for next year directly impact this age group. Half of participants have an annual income of $20,000 or less. So through a lens of health equity, we strive to include the voices and opinions of folks who are historically left out of policy development conversations, and that includes low-income communities. So half of the folks reported, again, having an annual income of $20,000 or less. And about half of participants, 49% of participants, have either an elementary or middle school education level, which is important to highlight. So I will hand it over to Paola to share some key findings for this year.
Thank you, Rosa. Next slide, please. Thank you. Hi, everyone. It's a pleasure to greet you again. The listening tour sessions provided key insights for what each region is facing and also potential policy opportunities that are centered in community. Overall, what we understood is that while the pandemic seems like it is over for many, others are still facing COVID-19 related challenges, especially the economic, health, and social repercussions it has on Latinx communities. Here we highlight the top 5 main priorities, urgent priorities that were present across all regions. These include employment rights and resources. We saw that folks were facing higher workloads, and also the wage is still not at a livable standard. Health and social services navigation support is another one, specifically around the Health for All Medi-Cal expansion. Though it is great and we're celebrating that this is furthermore expanding, we are also seeing that information is not reaching communities, and there are still so many questions around public charge, as Enriqueta mentioned earlier in the panel. There is also housing, especially again with the economic repercussions after lockdown, and families facing evictions as well after the eviction moratorium was lifted. Learning and back to school transition support was vocalized by many participants, especially with shifting over to the virtual world and navigating Zoom, and also taking on many roles as parents, directors, and teachers. And mental health services, which goes hand in hand with the previous priority. Youth, and as well as parents and folks in our communities are facing challenges as they're navigating mental health services and trying to obtain these for their children, for themselves, and for their families. And although those were urgent, there's other reoccurring themes that are present but are still very important. Digital equity, as mentioned, the increasing shift to the virtual world. There is not just about having access to internet, having affordable internet, but also the quality of internet and broadband. Voting and civic engagements, as we heard right in the panel with the upcoming elections, it's a very important theme as well that came up, and nutrition and healthy food access. So as we mentioned in a bit, we will be collectively exploring in breakout rooms how to address these priorities and other challenges via policy advocacy. But in the meantime, I'd like to connect LCHC's current programmatic work to address these challenges, which were vocalized by participants. Some of these active programs include Pasa la Voz. Lourdes Bernice, one of our promotoras present here, and others have been part of doing education campaigns around COVID-19 vaccines, employment rights, social services navigations, including housing and Health for All and Medi-Cal expansion. And another one is Salud en la Comunidad, which is about youth and youth substance use disorder. Health Ambassadors Initiative, which took place in Los Angeles and Central Valley to address the nutrition and healthy food access needs in those communities. And lastly, we would like to share a completed report that we collectively did with other organizations across the state that speaks about mental health needs and also the accessibility and the need for cultural sensitive programs around mental health. And you can find that link in the chat box and read more on that. Keeping in mind, these are not a one-size-fits-all solutions. So we really encourage everyone here during the breakout room to share their strategies, share their solutions. These are just some examples that we're providing from our end, but we would love to hear from you during those breakout rooms and also how we support Latinx communities in times of COVID-19 and post-lockdown. And I'll pass it back to Rosa for the next slide. Thank you.
Thanks, Bo. And I dropped the link to the full briefs in the chat as well, so you're able to access them and use them for whatever purposes you feel are necessary. I just want to acknowledge that we can't do this work on our own, so we really thank our partners, some of who you've heard from today already and yesterday, Líderes Campesinas, Poder Popular, Placer People of Faith Together, the Health Education Council, and the Comité Organizativo Latino de City Heights, in addition to our team of promotoras and promotores that work closely with LCHC. Thank you so much. We're also, I'll put in a plug, we're also looking to cover other regions later this year or early next year, including the Central Coast, the Bay Area, and the Inland Empire. So if any of you are looking to partner with us, we're happy to continue those conversations post-summit. Next slide.
Yes, thank you to all those partners. We really couldn't have done it without them. So the community research briefs, they include their 2-page front and back, and you will be able to see that in the front, there's a little bit of background about the region itself, county health indicators specific for that region, COVID-19 statistics, and in the back, you will be able to see the top 3 priorities that the community vocalized during their session for each of their specific region. And if we could drop that link in the chat, so we could share these briefs with our participants here, and you could take a look, a deeper dive, and also to help inform the discussions during the breakout rooms. And I'll pass it back to Rosa for the next slide.
We promise to keep it short and sweet. So just again, if you want more information on the listening tour or want more detailed information on the findings, you can contact me directly at the information that you see on the screen or visit our website. And just thanks so much to the research team comprised of very powerful mujeres, Ale, Jennifer, and Bao. Thanks so much. We'll hand it back to Matt.
All right, folks, welcome back. Welcome back. And just confirming with production that both breakout rooms are back.
Correct. Both breakout rooms are back.
Wonderful. Thank you so much for that. Well, folks, thank you so much for those rich conversations that we had during the breakouts. I know that our conversation in the CBO funding breakout was so powerful, and I can't wait to hear the feedback that we received in the other breakout room. So let me share some closing thoughts, and then after we do have a special announcement. So let me get started with just giving a recap of today and the past 2 days, right? Thank you so much for joining us for our summit. Today, we were inspired, rooted, and challenged throughout our summit conversations. In our civic engagement panel, right, we heard about the powerful work that we can get done in coalition, collaborating with one another, working with all communities of color to achieve the change and the justice that we want to see. And we heard about that powerful privilege that it is to be able to vote in this country and how our vote really can impact our health, right? Very directly, and it can impact the health of others. We heard about, Timmy shared his story about voting for his parents at the age of 10, right? And influencing that vote. And we know that's the reality for many immigrant and refugee families where children and youth play a very formative role in the political standing of that family. And we know that in America, that is such a beautiful piece of our democracy as well, to be able to have intergenerational homes really coming together to participate in the system that many times leaves others out. So let's remember that as we're engaging, that our vote matters not just to our family, but our whole communities. And that, we can ensure that the right folks are representing us. In our Health for All panel, we heard about the powerful work that we have been able to achieve, the powerful work that we are yet to achieve, right? In that partnership, in that empathy and that trust with different organizations, with government, with philanthropy, making sure that we are working together in unity to continue moving those justice movements forward. And finally, in our funding for CBOs panel, we heard about the important partnerships needed to move forward those social movements that community-based organizations are moving forward, and the sustainability piece that is key to continue moving these conversations forward. So thank you all so much for engaging with us. Again, it is an honor as the LCHC Familia to host you all in this yearly annual summit. You met multiple members of our team, from the wonderful and powerful programs team to our policy team. Our development team was present during the breakouts. You saw our board members throughout the day. For us, this work is done in unity as an LCHC team, as an LCHC Familia. And we are so proud and honored and privileged to be able to do this work with you all. So we thank you for all the work that you do individually in each of your roles in your organizations, and we are so happy to partner with you. All right, up next, we do have an exciting update. And for this update, I would like to invite Dr. Talamantes, who is our board chair, and Dr. Jeffrey Reynoso to join me in this conversation.
Great, thank you so much, Cecia, for wrapping us up. And I know it's been a long day, so I appreciate everybody who's tuned in throughout the day. And you get, because you stayed, you're the first to know some breaking news. So, but before I get there, I want to thank everybody who made the summit possible, the staff, the board, Octavio Gonzalez from 4th Street Bridge Strategy. Shout out to everybody that made this summit a possibility. So join me in the chat, emojis, and thanking them for all of their efforts. So now with the breaking news, after over 5 years in the role, I'm stepping down as executive director of the Latino Coalition for Healthy California. I know that change is hard, but it's necessary and it's part of life. And I leave LCHC with my heart full, knowing that the mission of the organization rests in the people that make this work possible and that are advocating for the Latinx health equity movement. We, shoulder to shoulder with the LCHC network, have collectively made, and I know you will all continue to make, a difference in advancing critical conversations with decision makers to allocate the just budget, resources, policies, and programs commensurate with our representation in California. As we enter our 30th year as an organization, it's, I think, really important to acknowledge our past. It was in 1992, when healthcare reform debates were happening at the state and national levels, that provided a unique opportunity for LCHC to form itself and make an impact on the health of the Latino and immigrant community here in California. At the same time, there was violence happening in South Los Angeles after the Rodney King verdict had exposed years of institutional racism and mistrust with law enforcement and the criminal justice system among diverse racial ethnic communities. And it is in these days where our founders at this organization, others, could have retreated into our corners and pitted against one another. The health advocates and leaders instead came together to build power collectively. They founded organizations like the Asian and Pacific Islander American Health Forum, the California Black Health Network, the California Rural Indian Health Board, and the Latino Coalition for Healthy California, who came together in this context to build a common health policy agenda specific to low-income, immigrant, and communities of color. This later became the California Pan-Ethnic Health Network. I see some of you here today, who is one of our key partner organizations. Fast forward, when I was selected as executive director in the beginning days of the Trump administration, we were facing similar crises as a nation and as a state, with anti-immigrant policies like the draconian public charge ruling and the inhumane family separation policy. But the same problems require new leadership and new ways of thinking. If the latest LA City Council incident, which I know we've discussed throughout the summit, has taught us nothing, it is not sufficient to have a Latino or a Latina or Latinx person in a position of leadership if these leaders do not represent our shared values. We need leaders who actively combat anti-Black racism. We need leaders who combat anti-Indigenous racism and colorism. We need leaders who combat sexism and homophobia and transphobia. We need leaders who combat ableism and xenophobia and classism and all of the complexities who belong to these multiple identities. And leaders who just don't do it on an interpersonal level, but are creating new policies, systems, and organizations, and are driving community transformation for healthier, more vibrant communities. And all of you are leaders in your respective organizations and roles and in your communities. It's why my biggest legacy at LCHC is a team that we recruited who hold these values and represent many of these identities and are living examples of what health equity means in action. It's how we live our lives. It's how we carry out the work at LCHC. So with that, I leave this position with a lot of gratitude to the team, to the board, to the partners, the funders, the broader network. And I know the work is not going to pause, and we will all continue to advance and protect Latinx health equity. As I embark on my next career role, which I'll share when it's public, I will continue to be a supporter of LCHC's mission, and I look forward to the new heights that the future leadership will take the organization. Adelante. And now with that, I'm going to hand it over to our board chair, Dr. Efrain Talamantes.
Well, Dr. Reynoso, thank you so much for the opportunity to share a few words. My name is Efrain Talamantes. I am actually an internal medicine physician, primary care at Ultimed. Wasn't able to join you all yesterday. I have my clinic, and because it's so sacred for me to take care of my patients, but really that I was looking forward to the summit. It couldn't have come at a better time, given some of the clear challenges that we're facing and really the pain and hurt and need for healing. But I've seen Jeff take on these challenges continuously, and we're very proud of him as a board. He's grown tremendously. He's left LCHC to an incredible team, but also with an incredible intention around how we at LCHC think about not only embracing the realities of some of our past, but really looking forward to our future and really incorporating the community's voice, really ensuring that accountability to what we stand for, and making sure that providers like myself at a community health center are able to also voice our needs as our patients come to us continuously, sharing the unfortunate situations they're put in, given some of the continued structural inequities and racism, clear racism that they're facing. Jeff's done a tremendous job. Not only has he built an incredible team, but he's really put this organization on a sustainable path. Not only has he ensured that we grow our footprint within California, but even throughout the country. And I'm excited. I know we can't share where he's going, but we're really proud of him. And I know that news will be forthcoming. But most importantly, what I'm most proud of Jeff is that he, with much intention, ensured that LCHC would continue in great hands with an incredible leader, a thought leader, someone who is not just about making sure that we reflect the community, but has a tremendous amount of substance personally and professionally to carry the organization forward. And I know she's already taken on the role, but Dr. Cecia Aquino is our acting LCHC executive director. And our board is going to continue to work with her and the rest of the team and even ensure that there's community input as we formalize our selection of an executive director. And we know we're encouraging, obviously, Dr. Aquino to continue in this role, but knowing that there's a short timeline, this was really our opportunity to ensure that she takes on this role and we continue this process. We're really grateful for all of you and your support. I know, again, Jeff will continue to be a great mentor and influencer around the work that LCHC does. He won't, I know he's promised not to be too far from us, but more importantly, that we want to continue our relationships with all of you. We want to ensure we hear from you. We want to ensure that the work that this summit has produced is really what we continue on as a board, and really that the team, the incredible team, LCHC team that you've had a chance to meet and hear from throughout the summit, that we continue to support them. An incredible talent, our future leaders, really our future, and they will propel us forward through these trying times, and they will ensure that we, as we get outdated in our thinking, that we're kept on our toes, that we refresh and update really outdated thinking and outdated policies, outdated language that often is very harmful, and it leads to poor decision making and also resource allocation. And we want to continue to make sure that LCHC continues to have that connection to the community. So with that, Jeff, I just want to personally thank you. I know when I first met you, it was when you were announced as executive director in Sacramento at Mayahuel, at one of the restaurants there. And I also got to meet your brother, your family, and how important your success is to not only your family, but all of us. And so very proud, and we look forward to continuing to work together at so many different capacities. And so with that, let me go ahead and turn it back to the team here. And thank you all for your patience and support.
Thank you so much for that. It has been a pleasure working alongside Dr. Reynoso over the almost 3 years now, and really being an integral part of that growth that LCHC has seen. I am so excited and honored to step into this role as acting executive director. Thank you to the board and the LCHC team for your vote of confidence. I don't take that lightly. It is a huge privilege for me, and I really thank you from the bottom of my heart. For LCHC, this is an exciting time. This December, LCHC will be celebrating our 30th year anniversary. We like to call it our double quinceañera. In 2023, we will be celebrating with all of you, launching a 30-year campaign so we can make sure that we are going throughout the state celebrating with all of you, and that you can join for this double quinceañera. And, in addition to that, next year is a big one for us. This year, we have been hard at work leading strategic planning with our team. And next year, we will be launching our innovative 5-year strategic plan. So please join us for that. We will be inviting you to those conversations as well. And we are not pressing the brakes at all. If anything, we are revving up the engine. We are turning a page on this new chapter with strength and in power. I am elated to continue to work along our powerful and diverse team, from Paola, Jake, Angela, Oscar, Giselle, Robert. And actually this year we welcome 2 new positions, actually directorship roles at LCHC, which didn't exist in the past. And Rosa and Mar stepped up as our directors of programs and policy respectively. And we are just so excited to see these powerful leaders in these roles and for the work to continue. We honor and thank the hard work of our full team, contractors, community, promotoras, our students, our fellows. The LCHC team is a powerful one because we work together and in unity. Together, we will imagine new ways in which we can continue to build our communities in collective power, hand in hand with our fellow communities of color, to push forward next year's LCHC policy agenda. And with that, I thank you from the bottom of my heart. Please feel free to reach out with any questions, ideas, or partnerships. I would love to connect with each and every one of you. Muchísimas gracias.
Thank you all for coming, everyone.
Sorry. Thank you, everyone. It was great.
Thanks, everyone.
Thank you, everybody. Thank you for joining us.
Gracias y hasta pronto.
Hasta pronto.